I'm like,
I've got you covered. So
I was thinking,
Let me know what else you need.
Okay, good afternoon, and welcome to the Health and Human Services Committee. My name is Senator Ben Hansen. I represent the 16th Legislative District in Washington, Burt, Cumming, and parts of Stanton counties, and I serve as chair of the Health and Human Services Committee. I would like to invite the members of the committee to introduce themselves, starting on my right with Senator Ballard.
Bo Ballard, District 21, Northwest Lincoln and Northern Lancaster County.
sorry. Lynn Walls, Legislative District 15, all of Dodge County and Valley.
Brian Hardin, District 48, Kimball, Banner, Scottsbluff counties.
Kayla Kavanaugh, District 6, West Central Omaha, Douglas County.
Merv Rippey, District 12, which is southeast or southwest Omaha, and the city of Ralston.
Okay, also assisting the committee is our legal counsel, Benson Wallace, our committee clerk, Christina Campbell, and our pages for this afternoon is Peyton and Tessa. A few notes about our policy and procedures for today's hearing. Please turn off or silence your cell phones. We will be hearing 4 bills, and we'll be taking them in the order listed on the agenda outside the room. Hopefully, we won't go until 9:30 tonight. On each of the tables near the doors to the hearing room, you will find green testifier sheets. If you're planning to testify today, please fill out one and hand it to Christina or one of the pages when you come to testify. This will help us keep an accurate record of the hearing. If you are not testifying on the microphone but want to go on record as having a position on a bill being heard today, there are white sign-in sheets at each entrance where you may leave your name and other pertinent information. Also, I would note if you are not testifying but have an online position comment to submit, the legislature's policy is that all comments for the record must be received by the committee by noon the day prior to the hearing. Any handouts submitted by testifiers will also be included as part of the record as exhibits. We would ask if you do have any handouts that you please bring 10 copies and give them to the page. We do use a light system for testifying today. Each testifier will have 5 minutes to testify. When you begin, the light will be green. When the light turns yellow, that means you have 1 minute left. When the light turns red, it is time to end your testimony, and we will ask you to wrap up your final thoughts. When you come up to testify, please begin by stating your name clearly into the microphone, and then please spell both your first and last name. The hearing on each bill will begin with the introducer's opening statement. After the opening statement, we will hear from supporters of the bill, then those in opposition, followed by those speaking in a neutral capacity. The introducer of the bill will then be given the opportunity to make closing statements if they wish to do so. On a side note, the reading of testimony that is not your own is not allowed unless previously approved. And we do have a strict no prop policy in this committee. And like I mentioned before, each testifier will have 5 minutes to testify unless we'll kind of try to keep a record of who's testifying for each bill. And if they get a lot of testifiers for certain bills, we may narrow it down to 3 minutes. So with that, we will begin today's hearing with LB 419 and welcome Senator Wishart to open. Welcome.
Thank you, Chairman Hansen and members of the Health and Human Services Committee. My name is Anna Wishart, ANNA-WISHART, and I represent the 27th Legislative District, including West Lincoln and parts of southwestern Lancaster County. I'm here today to reintroduce LB 419, a bill to expand Medicaid coverage for postpartum women from 60 days to 12 months. Most people are familiar with the 3 trimesters of a woman's pregnancy. But more and more experts are recognizing that the time after a woman gives birth as the 4th and 5th trimester of her pregnancy. The weeks following birth are critical to a woman, the baby, and the whole family's long-term health. We're used to the idea of many visits to the pediatrician for a newborn during their first few weeks of life. But for new mothers, typically there is only one postpartum visit scheduled around 6 to 8 weeks after she gives birth. The American College of Obstetricians and Gynecologists recommends a comprehensive postpartum visit within the first 12 weeks, providing a full assessment of physical, social, and mental well-being that includes mood and emotional well-being, infant care and feeding, physical recovery from birth, chronic disease management and health maintenance, and long-term planning for the coordination of continued care. Their committee recommends that, quote, the changes in the scope of postpartum care should be facilitated by reimbursement policies that support postpartum care as an ongoing process rather than an isolated visit. The Department of Health and Human Services agrees. In their report, maternal morbidity and Mortality in Nebraska, released September 2021, they recommended extending Medicaid eligibility to 1 year post-pregnancy. Great care is taken during the first 3 trimesters of a woman's pregnancy, and it is time that the same level of attention and care is paid to women and their families following the birth of a child beyond that 4th trimester. You will hear from many women and advocates today to discuss additional research and experiences that will provide you with a full picture of why this bill is essential for new moms and their babies. This is a bill that I am seriously considering prioritizing and hope this committee does as well. That's how important this issue is to me. I also want to thank the 27 co-sponsors of this bill. Almost every single female senator in the legislature has co-sponsored this bill, as you can see. And I also want to thank Ivy Black Girl for their tireless efforts on this legislation over the years. Thank you. And before I close, I did want to point out that this fiscal note has been updated from the previous year when I was circulating this legislation on the floor for co-sponsors. I had mentioned when asked that the fiscal impact was around $7 to $8 million. The updated fiscal impact, as you'll see, actually comes in lower than that. For 23-24, it would be $4 million in general funds, matched by federal funds. And then it would be $6 million for 24-25, and that covers approximately 2,370 new eligible women in this state. Thank you, and I'd be happy to take any questions.
Thank you for your testimony. Are there any questions from the committee?
The Biden administration's basically taken a position that this is a service that cannot be limited to those that are had an abortion. It has to be made available to all Medicaid recipients, all Medicaid mothers. Does that change your fiscal note? Or was your fiscal note driven only on the one that projection of how many might have had otherwise or did have an abortion?
Well, this fiscal note is created by the Department of Health and Human Services, and it looks at the current women who are eligible and then what it would cost just to expand their healthcare coverage after they give birth from the current time period to a full year.
And you and I've had a discussion that depending upon what happens with the abortion issue, which is not going to be taken lightly by any means, this could be a play to it. I know in other states they are doing this.
Yes, so 29 states
29.
have expanded healthcare coverage, and 6 additional states are on their way to doing that as well.
Okay. Thank you. I think it's a worthy bill for discussion.
Thank you.
Any other questions from the committee? Seeing none, we'll see at the close, I'm assuming.
Yes.
All right, so with that, we will take our first testifier in support of LB 419. Hey. Welcome back, both of you.
Good afternoon. My name is Naomi Thompson. That's NYOMITHOMPSON, and I'm representing Ivy Black Girl. Ivy Black Girl is a reproductive justice organization that centers Black women, femmes, and girls, because when we do that, everyone benefits. I'm testifying in support of LB 419 because expanding postpartum coverage is central to addressing inequities in maternal health imposed on birthing people, especially Black women. Several socioeconomic and racial inequities experienced by Black people with the capacity for pregnancy are, in part, due to capped state Medicaid coverage for women at 60 days after the end of pregnancy. Racial inequities in healthcare access and health outcomes cross all sectors of our healthcare system, but maternal and infant health outcomes present some of the starkest mental and physical disparities. For example, The severe maternal morbidity rate is 63% higher for women in Black communities than in white communities. Black birthing people are more likely, compared to white birthing people, to endure risk factors during birth that increase the likelihood of infant mortality and can have long-term negative consequences for children's health. Around 1 in 9 new mothers experience postpartum depression, which disproportionately impacts Black birthing folks, resulting in Black birthing people being more likely to have postpartum depression, yet less likely to receive treatment. Black women suffer from short-term and long-term pregnancy-related causes more than 3 times the rate of white women. Overall, Black birthing folks are more likely to be uninsured and face other barriers to care. One contributing factor to these disparities is a lack of healthcare access for postpartum women who receive healthcare insurance through Medicaid. Research shows that coverage before, during, and after pregnancy facilitates access to care that supports healthy pregnancies, as well as positive maternal and infant outcomes after childbirth. To achieve optimal Black maternal health outcomes in the state of Nebraska, it is essential to further expand meaningful access to affordable and consistent mental and physical health care for Black birthing folks, wherever they live throughout their lives. Please consider moving LB 419 forward, and thank you for your time.
Thank you. Are there any questions from the committee? Yes, Senator Kavanaugh.
We have to know who this cutie pie is.
Her name is Troy.
Hi,
my
Troy.
daughter.
She's so quiet in her descent to get down from the chair. Thanks for being so good.
No, she was really excited to be here. She was
Oh.
like, "I'm gonna go talk to our friends." I was like, "Yes, these are our friends. Fine."
And how old is she?
How old are you?
2. 2. Well, thanks for being here, Troy. And thanks for your testimony, Naomi.
Of course, yes.
Any other questions from the committee? All right, seeing none. Thank you.
Thank you.
Take our next testifier and support.
Is that a problem? Destroys help. Destroy things.
Hey, welcome.
Good afternoon, Chair Hansen and members of the Health and Human Services Committee. I'm Dr. Ann Anderson Berry, for the record ANNANDERSON BERRY. I'm a faculty member of UNMC and the medical director of the Nebraska Perinatal Quality Improvement Collaborative. However, I am not speaking as a representative of the university today. I am here speaking as an individual and on behalf of Nebraska Medicine and the Nebraska Medical Association, as well as the Nebraska Perinatal Quality Improvement Collaborative with regards to LB 419. As a neonatologist, I work with hundreds of families each year with high-risk medical situations for both mother and baby. Additionally, I support healthcare professionals from across the state who provide care that leads to the best outcomes for Nebraska mothers and infants, working to ensure that every family has the healthiest start possible. Unfortunately, we still face situations every day where inadequate access to healthcare impacts mothers and therefore their ability to care for their children. In the NICU, we have many preterm and seriously ill newborns whose stays extend past the 60-day postpartum period that Nebraska currently provides postpartum coverage in Medicaid. It is common for mothers to discuss their health with me as their infant's doctor. When medical coverage expires, mothers lament their inability to refill their antihypertensive medications, seek care for perinatal depression or easily treated diseases like mastitis, which left untreated can prevent breastfeeding and cause serious illness. What is less obvious and just as concerning is the impact of this lack of health care on the newborn infant, the family, and other Nebraskans. As healthcare providers, we know that postpartum care is an ongoing process that typically requires multiple visits and follow-up care that may last a full year. This is particularly important for those who experience pregnancy complications or have chronic conditions such as hypertension or diabetes. The implications of lack of healthcare coverage for maternal health is profound and plays a role in the rising U.S. mortality rates. Suicide drives maternal mortality rates in the first year among pregnant and postpartum people and has risen over the past decade with poorer access to treatments among birthing people of color and low-income women, driving disparate outcomes. Mental health treatment and coverage can prevent death. As a neonatologist, I know from experience the death of a mother is one of the most tragic events that a family can have and it affects the entire community. The short and long-term impact of such a tragedy on her surviving children, family, and community, and the healthcare professionals who cared for her cannot be overestimated. We also know that the health of the child is linked to the mother's health. Improving these outcomes for mom will also improve health of the child, as noted in the 2020 Surgeon General's Call to Action and the Health and Human Services Action Plan. Lack of access to healthcare and insurance coverage contributes to poor outcomes and racial and ethnic health disparities. Extending coverage provides an opportunity to monitor recovery from pregnancy and birth, as well as to address ongoing health outcomes and concerns with behavioral health. Improving women's overall health reduces chances of complications during subsequent pregnancies, presenting costly subsequent NICU admissions for the state. A study in 2017 found that improved maternal coverage was associated with improved attendance at well-child visits, which are the primary platform for growth and development screening, vaccination, and provision of anticipatory guidance. Children who attend these visits are more likely to complete immunization and less likely to have avoidable hospitalizations, reducing state expenditures. Untreated maternal depression significantly impacts the health and well-being of women, infants, and families. Low-income mothers are more likely to experience depression as high as 40 to 60%. And we know perinatal depression is associated with poor outcomes in children, including increased morbidity and mortality, family dysfunction, and increased risk of abuse and neglect from impaired child-parent interactions and bonding, and attachment issues that lead to delays in motor, cognitive, and language development, discontinuing of breastfeeding, failure to thrive in colic, and emotional and behavioral disorders that persist into adolescence. Untreated maternal depression is associated with increased medical costs and inappropriate medical treatment of the infant. Mothers not covered under Medicaid may not get the appropriate care, including diagnosis, therapy, and/or medication. In conclusion, Nebraska's mothers and babies need the work of not only our perinatal collaborative, but of all stakeholders, including, most importantly, our state governing bodies. Supporting maternal health care for 12 months after delivery will have an important positive impact on Nebraska babies and their families. I urge you to provide this coverage to Nebraska mothers. Thank you to Senator Wishart for introducing this legislative bill. Nebraska Medicine, the Nebraska Medical Association, and NPIC will continue to work to support the perinatal health coverage to ensure Nebraska moms and babies have the healthiest start possible. I'd be happy to answer any questions you might have.
Thank you. Are there any questions from the committee? Senator Reapy.
Thank you, Chairman Hanson. I know you're a physician, but you're probably somewhat informed too. Do most commercial carriers provide the same benefit?
Well, most women who have commercial coverage have continuation of coverage. So they don't lose their coverage at 60 days postpartum because their coverage is provided through their families.
That's your experience with most commercial health plans?
That's my insurance with most commercial health plans, yes.
Okay, thank you very much.
Yeah.
Thank you.
Any other questions? I have a couple questions. A prevailing theme we kind of hear when people such as yourself, with your experience, I mean, come here, we usually always hear that maternal health has gotten worse over the years. Why is that?
Population health has gotten worse over the years. So we have more and more women entering into pregnancy with existing hypertension, existing diabetes, existing obesity, existing lack of health care. Also, women are older at the age of first and subsequent deliveries, and that leads to riskier pregnancies as well. So there's a lot of population issues at force, which, institutions like MPIC and physicians like myself, are working. It's an uphill battle. We continue to work. We have to strive to optimize the systems and optimize the care given public health influences that are really making our population a much more unhealthy population than it was 10 and 20 years ago.
Okay. I think that's what I hear. I know we always try to address the symptoms of a cause of problem, but I always like to see if there's what the root cause is. So a lot of times with a bill such as this, which I'm not saying is bad or good, addresses the symptomatology of the overlying issue that we have in healthcare, which is an unhealthier lifestyle, I think, right? Is there anything you think the state could do to help address the root cause of why we have more hypertension, more diabetes, as opposed to just treating the symptoms?
I think access to healthy food and subsidization of processed food across multiple points of government have led to part of are significant problems with obesity and hypertension, salt intake, processed food intake. It's much easier to eat a processed food diet than a whole food diet. Those are the subsidized foods, and those are the easily attainable foods if you are on a low income budget. We have food deserts across Nebraska. So we have many of our low income moms that live in food deserts where they can't buy fresh food without traveling significant areas. That's a rural and an urban problem. And so they're left with the processed foods that are in convenience stores as opposed to a full complement of fresh foods that those of us with means are able to drive to and attain and then have the resources to prepare those foods. So there are some fixes that seem simple, but because of how we've institutionalized food processing and availability are really big battles to overcome. We need to take salt out of our diet. I sound like I'm preaching like your mother, but you are what you eat, and hypertension and diabetes and obesity are directly related to that. So yeah, there are things that we can do. I still think that this bill is good, whether we do them or not. Women need health care. Women need and deserve health care. But there are bigger battles to fight once we can ensure coverage for these women.
And I think you're right. I think, this feels like this are important, but I hate to see us just kind of keep contributing to help the symptoms when we're not really addressing what the problem is. So I appreciate your insight. So
thank you.
Any other questions from the committee? Yes, sir.
I just have a quick question. I think one of the things that was toughest for me after I had our children was the time after my maternity leave was over. And I had to go back to work. That's when the stress really started to compile. Can you talk a little bit about that, or do you see that as a piece to this?
Return to work is incredibly difficult in the postpartum period. Nebraska has an incredibly high rate of working mothers. At one point, probably 7 or 8 years ago, it was quoted as the highest percentage of working mothers in the nation, the state where we're Midwestern individuals. We work, we pull our own weight, and that return to work is associated with cessation of breastfeeding. It's associated with return to childcare, or with so many moms and low-income moms who can't afford childcare. And so then they are doing shift work with partners or other family members, so that when they're not at work, they're doing childcare, and they never have opportunity to rest or to get health care. So access to care among our low-income moms is hindered not only by payment, but also by availability. If you're working and taking care of your child constantly and you don't have good transportation, it becomes very impossible to get to the doctor to account for your own mental health. These things are so entwined. There's so many systems at play. This is one very tangible way that we can say we support moms for the entire year. If you have hypertensive disorders of pregnancy, that doesn't end at 6 weeks, 12 weeks, or 60 days. Those women have a variety of changes in their physiology that require continual monitoring and medication adjustments. And if you can't get those medicines after 60 days, let alone have them monitored and adjusted, your risk for stroke, your risk for subsequent preterm delivery, seizure, hemorrhage, they're astronomical compared to women who have means and can get that care and monitoring.
Thank you.
Thank you.
Any other questions? Senator Repeat.
You cited a number of things that have been deteriorating in terms of individual health. Do you see the drug culture is contributing to all of that? Or, on a scale of 1 to 10, where would that fall in? Because we hear so much about it anymore.
We do know that women who use substances are at increased risk for preterm delivery and unhealthy pregnancies. And I think it would be hard for me to scale on 1 to 10. I certainly would put obesity, diabetes, and hypertensive disorders, as 8, 9, and 10. Substance use and misuse is, maybe a 5 or a 6. It is, Nebraska is fortunate to not be in the throes like some Appalachian states, West Virginia, Ohio, where they have entire units full of infants that are going through drug withdrawal. But it's a reality that we encounter on a regular basis. These are issues that we're managing. They're issues that can be managed medically to ensure the health of the mother and the infant. And so it's certainly coverage that needs to be considered as well. Thank you for that question.
Thank you very much.
Any other questions? Seeing none, thank you.
Thank you for the opportunity.
We'll take our next testifier in support.
Good afternoon, Chairman Hanson and members of the Health and Human Services Committee. My name is Tom Benzer, T-O-M-B-E-N-Z-O-R. I'm the Executive Director of the Nebraska Catholic Conference, which advocates for the public policy interests of the Catholic Church and advances the gospel of life through engaging, educating, and empowering public officials, Catholic laity, and the general public. Catholic social teaching has a rich tradition of contemplating and solving the difficult issues that face our society and common humanity. One important principle, among others, offered by Catholic social teaching that we should keep constantly in mind is the preferential option for the poor. Preferential option for the poor is a special form of primacy in the exercise of Christian charity. It affects the life of each Christian in as much as he or she seeks to imitate the life of Christ, but it applies equally to our social responsibilities. This love of the preference for the poor and the decisions which it inspires in us cannot but embrace the immense multitudes of the hungry, the needy, the homeless, those without health care, and above all, those without hope for a better future. This Christian charity for low-income mothers and families who lack access to basic and necessary health care is the impetus for the Nebraska Catholic Conference's support for Senator Wishart's LB 419, which would extend postpartum Medicaid coverage from 60 days to 1 year. Maternal mortality and morbidity are issues that are increasingly on the consciousness of many, in large part because of the significant increase of both issues in recent years. As a report on maternal morbidity and mortality in Nebraska states, CDC reports that the rate of maternal mortality has been increasing since the 1980s, with the United States experiencing a higher maternal mortality rate than most other developed countries. The report further states that severe maternal morbidity is more than 100 times as common as pregnancy-related mortality and has increased up to 75% in the last decade. But this does not have to be the case. Access to basic medical coverage for an extended time frame postpartum can provide the continuity of care needed to avoid and diminish the cases of mortality and morbidity that our Nebraska mothers are facing. For a mother who has her own set of health care needs, is without adequate support, and is also responsible for taking care of the needs of her child or children, it becomes an imperative for the state and federal government to step in and provide the necessary assistance for health care coverage. To draw again from the Catholic social teaching tradition, this type of support, assistance, and care is in line with the principle of subsidiarity. Subsidiarity recognizes the basic fact that there are times when local and intermediate institutions like the family, churches, nonprofits, and private industry cannot fulfill some important needs of the larger community. When this occurs, it's wholly appropriate and even necessary for the larger political community to assume a proportionate responsibility in our care and concern for those in need. While the Nebraska Catholic Conference is not the public health expert on this topic, the personal and public health care benefits of LB 419 are numerous. Extended Medicaid postpartum coverage will help mothers deal with any number of issues that can present during the perinatal and postpartum period, such as gestational diabetes, preterm labor, recovery from cesarean sections and high-risk pregnancies, preeclampsia, maternal depression, and other mental health concerns, sepsis, pulmonary edema, and acute heart failure. Coverage also provides for future healthier pregnancies, as well as assisting mothers be more proactive in the healthcare they pursue for their newborns and infants. It can also help improve the healthcare disparities which occur among racial minorities and the poor. The benefits are numerous, and though the cost is not negligible, it is a cost that is well worth the benefits to the common good and to our recognition of the human dignity of the mother and her baby. In the post Roe versus Wade culture of life we're trying to build here in Nebraska, where every preborn life is accepted in their full and inviolable dignity as a human person, it is also incumbent on us as a political community that we are walking with mothers in need. The Nebraska Catholic Conference firmly believes that LB 419 is an important piece of advancing a culture that loves them both. For these reasons, Nebraska Catholic Conference respectfully urges your support for LB 419. Thank you for your time and consideration, and happy to take any questions.
Thank you, Mr. Benzer. Any questions? Seeing
All
none.
right.
Thank you.
Thank you very much.
Any other proponents of LB 419? Welcome.
Thank you. Good afternoon. I'm Dr. Carla Lester, Karlalester. I'm a pediatrician, founder of Teach a Kid to Fish, and chair of the board of Milkworks. As a physician and mom of 3, I want to express my thanks to Senator Wishart for introducing LB 419. I'm here today to testify on behalf of Milkworks and in support of LB 419, which, as you know, intends to expand Medicaid for postpartum coverage from 60 days to 12 months. Milkworks is a nonprofit community breastfeeding center that has served families throughout the state of Nebraska for 22 years. The mission of our organization is to create a healthier community by empowering families to meet their breastfeeding goals. Milkworks provides individual clinical lactation support from board-certified professionals in person in Lincoln and Omaha, and via telehealth to the rest of Nebraska. In 2022, Milkworks served more than 7,200 families. Medicaid families accounted for 17% of those services. The lifelong health benefits of breastfeeding for mothers and their infants are well documented. And for most of them, the benefit is related to how long and how much they breastfeed and are breastfed. The American Academy of Pediatrics recently revised their statement on breastfeeding to recommend that babies breastfeed for at least 2 years and then as long as is mutually desired. But breastfeeding does not come easily to many mothers, and our culture continually throws barriers in their path. These barriers are expounded for mothers with financial need. If a mother needs help with breastfeeding related issue beyond the first 60 days of her child's life and has lost her insurance coverage, she is less likely to seek clinical help. For those needing lactation support, this will undoubtedly affect their ability to breastfeed for the recommended timeframes. Moreover, health problems during pregnancy and postpartum months impose an additional economic burden on families, communities, and the health system. Extending Medicaid coverage could potentially mitigate part of this burden by ensuring that moms can receive the support that they need. As a pediatrician in Nebraska for nearly 22 years, and longer than that overall, I know that infants who qualify for Medicaid are already guaranteed coverage for the first year of life. Mother-baby dyads should have aligned coverage. Pregnancy-related health issues such as cardiovascular complications, postpartum depression, and breastfeeding support needs may not surface until weeks or even months after delivery. Lack of health insurance coverage creates even more complications such as delays in seeking care and appropriate follow-up, therefore putting both the mom's and the baby's health and well-being at risk. LB 419 is long overdue in Nebraska. I urge the legislature to pass this very important bill to help ensure the health of all moms and babies in Nebraska.
Thank you.
Thank you.
Any questions? Seeing none? Thank you.
Thank you.
Any other proponents? Hi, welcome.
Good afternoon, members of the committee. My name is Shannon Hilaire, spelled S-H-A-N-N-O-N, last name Hilaire, H-I-L-A-I-R-E, and I'm here to express my strong support for Legislative Bill 419. I come to you today as a mama. Birthing babies ain't easy. That is one of my mom's favorite lines from the movie Gone with the Wind. I'm a proud mommy to a sweet as sugar 3-year-old named Holiday, and an expecting mother to a son scheduled to arrive this summer. Birthing babies ain't easy is a phrase I have constantly reminded myself as I've gone through this journey called parenthood. When I first found out I was expecting, I was elated. I did everything the new mamas do. I interviewed pediatricians. I downloaded all the pregnancy apps. My husband made me eat very healthy despite all of my cravings for Arby's. I painstakingly designed the nursery. but all of that joy became overshadowed as I started having more complications as the weeks went by. I experienced issue after issue, and I would often joke that if pregnancy symptoms had a bingo card, I would undoubtedly receive a full blackout. I had issues using my hands from severe carpal tunnel syndrome. I threw up almost every day from nausea or debilitating migraines. I suffered from constant embarrassing bloody noses, sinus issues, and restless legs. Sciatic nerve pain came later. Birthing babies ain't easy. But through all of this, I could not wait to meet our baby girl and kept reassuring myself, suck it up. Millions of women have done this. You can do it too. A month before I was due, I woke up to extreme swelling. I kept changing my clothes and needed help from my husband doing so because I would swell instantly in what I was wearing. This was a nice preview of what it was like to have a toddler. You never get dressed alone again. I had trouble seeing. I was extremely nauseated and then quickly out of breath. And I kept reminding myself, this is 8 months pregnant and this is just how it goes. It's really hard. On Easter evening, my oldest brother said something to me that no pregnant woman wants to hear. Hey sis, your feet look really fat. At first, I didn't say something nice back, but then I stopped and thought about it. Swelling, trouble seeing, feeling terrible. They'd mentioned this to me at appointments that this could happen. This must be preeclampsia. Preeclampsia is high blood pressure or extreme hypertension that can occur during pregnancy. If not treated, it can be fatal for mommy and baby. It impacts 1 in 25 pregnancies in the United States, and I personally know 5 women who have dealt with it and 1 who even lost her baby from failure to going into the hospital quick enough when she felt symptoms. Thankfully, I had a cuff at home and I took my numbers. My blood pressure numbers were alarmingly high, and I remember that it was physically painful to take it. When I arrived at the hospital, my OB nurse relayed a message to me that I will never forget. If I hadn't come in that night, neither of us would have made it. My husband would have woken up to a lifeless wife and baby next to him. I would have undoubtedly suffered a massive stroke in my sleep. When I arrived, I was strapped to a hospital bed and had to sign something saying I would not hold my daughter alone when she arrived. If she arrived, okay. They discussed with us that it was a possibility. My numbers continued to creep up and undergoing a C-section was not safe. I was administered multiple medications. I was considered a seizure and fall risk. Throughout the next few days, my blood pressure was taken every 15 minutes on the dot, even though they kept wanting me to relax. Very difficult to do. The numbers continued to creep up. I remember one reading was as high as 212 over 110, with a normal reading being 120 over 80. Thankfully, our daughter Holiday arrived a few days later, weighing just over 4 pounds. I remember she was smaller than a Chipotle burrito. Purple, so tiny, not crying, and needing resuscitation. There was a clock counting down on the wall from 5 minutes as she was taken from me, where they began to work on her. And they were so busy taking care of her, no one told me what that 5 minutes meant. And it kept ticking. My mom was in the room with my husband and I and frantically began taking photos of our daughter in case that is all we would ever have of her. My mom was an OB nurse for 25 years. She's seen it all. And that day she was very scared. After she was born, we were told my severe preeclampsia had been present for some time. My umbilical cord, which should look like a hose, disintegrated upon touching it. It had not just been affecting me, but also our daughter, who was quite tiny. And that is why LB 419 is so critical for mamas and their families, because preeclampsia and other pregnancy-related issues, gestational diabetes, issues nursing, postpartum depression, no matter how hard you try and all of the things you do to prevent it can rear their ugly heads at any time, not just during pregnancy, but even long after those 2 months. It's been 3 years for me and I'm still affected. Diagnosed.
I'm sorry, but we're going to have to wrap it up.
Yep.
Can you close your thoughts in the next
Yep.
few seconds?
There's so many stressors and concerns that come along with welcoming a new baby, but seeking care shouldn't be one of them. We can't take care of the little ones if we can't take care of ourselves. Thank you for your consideration.
Thanks for sharing your story.
Any questions? Senator Reapy.
Thank you, sir. You're certainly a person of courage that you went through a lot. My question would be is this a situation about the issue, or would you be a benefactor of it? What I'm saying is, are you a Medicaid recipient at this time?
No,
I see
currently
your
not.
general, okay. I was just curious whether it personally affected you. Thank you. Thank you, sir.
Thank you. Senator.
Thank you. Thank you so much for your story. Your daughter is very lucky to have such a strong mom. I think you were getting to a point in here about the preeclampsia, and you said how you're affected every day since then, which I can very much understand and sympathize with. Can you tell us a little bit more about the months after your daughter was born?
Absolutely. So she, being so small, had weekly appointments, and I had the one that was discussed earlier, maybe the 6 to 8 week appointment follow-up. But my blood pressure numbers were still really high. Most moms spend about 2 to 3 days in the hospital after having a baby. I was there for about a week and a half. Daughter was fine. My numbers continued to creep up. I'm still not able to get out of bed alone. So I have been on a blood pressure medication ever since and have to take daily blood pressure draws at home. With this pregnancy, I'm considered high risk and monitored quite closely. Taking a baby aspirin, taking all the medications, and constantly checked on any small headache, any swelling of the hands. They want to see me right away.
So postpartum, you had, and I'm sorry, I'm asking you some medical questions. If you don't want to answer, please don't. But postpartum, you personally had to be monitored for your blood pressure and be put on blood pressure medication.
Yes.
And then how long was it before you were able to carry your daughter?
By myself?
Yeah.
I think it was when we were released from the hospital and I was allowed to hold her alone.
Okay. So 2 weeks or so.
About to be by myself with her.
How does she feel about being a big sister?
She's very excited. She's got a lot of questions. A lot of questions.
It's okay if she's less excited once the baby's
That's
here.
what I've been told. We're working on. Again, reading all the blogs, getting ready to prepare for
Thank
here
you
for
so
that.
much for your testimony.
Thank you.
Any other questions? Seeing none, thank you.
Thank you.
Any other proponents? Welcome.
Thank you. Members of the committee, my name is Brian Cranwitter, B-R-I-A-N. Last name is spelled K-R-A-N-N-A-W-I-T-T-E-R. I'm the Government Relations Director for the American Heart Association here in Nebraska. And I have already submitted comments in support for this bill, but I guess I felt compelled just to say a comment or two about this. The previous testifier, Shannon, is a friend and colleague of mine. And needless to say, her story is not uncommon. Other women have gone through that. But the main thing I wanted to point out, 2 things. One, tomorrow's Go Red Day, Go Red for Women. And February is also Heart Month. And I can't think of a more appropriate and critical bill to be passed by this committee and the legislature and signed by the governor than LB 419, sponsored by Senator Wishart. And that's the main point I wanted to get across today. And I want to thank Senator Wishart for bringing this critical issue forward again. And I respectfully urge the committee pass this bill. Thank you.
Thank you. Any questions? Seeing none, thank you. Any others in support? Welcome.
Hello. My name is Scout Richters, SCOUTRICHTERS, here on behalf of the ACLU of Nebraska in support of LB 419. I first want to thank Senator Wishart for bringing this bill forward again this year. Deciding to become a parent is one of the biggest decisions we make. The ACLU of Nebraska works to ensure that Nebraskans can make these important decisions with autonomy and dignity and have the resources they need to ensure that their families and their communities thrive. This work includes ensuring Nebraskans have access to birth control and abortion care, prenatal and maternal health care, and that the rights of pregnant and parenting students and workers are protected. Every pregnant person deserves to receive quality prenatal and postpartum medical care. Yet, as you've heard from other testifiers, this is far from the reality for far too many Nebraskans. Again, as you previously have heard, we must recognize that the decision to have a child in the United States comes with disproportionate pregnancy complications, stillbirth, and maternal mortality for people of color and for Black women specifically. Extending Medicaid coverage for a longer postpartum period improves outcomes for parents, as you've heard, and we have to recognize that the current 60-day cutoff of coverage does not align with the reality for new parents in the postpartum period, and extending the coverage would undoubtedly lead to better outcomes for Nebraska families. So we urge your support of the bill, and I'd be happy to answer any questions.
Thank you.
Thank you.
Any questions? Seeing none.
Thank you. Thanks.
Any others in support? Welcome.
Good afternoon. Members of the HHS committee, I'm Karen Bowling, Karen Bowling, and I serve as the Executive Director of Nebraska Family Alliance. NFA is a nonprofit policy research and education organization. We represent a diverse statewide network of thousands of individuals, families, and faith leaders. The new state option to extend coverage for 1 year to assist postpartum mothers after birth is an opportunity for Nebraska to support improved maternal and infant health in the year following birth. The relationship bond between a mother and a child is a unique bond, like no other. We recognize this bond as one of the most special and life-affirming relationships in society. Efforts to provide additional postpartum assistance not only benefits the bond between mom and her newborn, but also provides mothers with necessary resources for healthy outcomes. The postpartum extension serves as a launch pad to drive improvements in maternal health and childhood development through the very critical first year of life. And Nebraska Family Alliance supports this, and we appreciate Senator Anna Wishart reaching out to us and reviewing the research that she has given us, and we support and encourage the committee to send to general file. Thank you. I'll take any questions.
Thank you. Any questions?
Thank you.
Thank you. Anyone else in support? We have one in the back. Welcome.
Hello. Good afternoon, members of the Health and Human Services Committee. My name is Adele Burke, ADELLEBURK, and I'm the Senior Manager of Public Affairs with Planned Parenthood North Central States in Nebraska. PPNCS promotes and protects sexual and reproductive health through high-quality healthcare, education, and advocacy. We are strongly in favor of LB 419, which would extend vital healthcare services to new families across our state. As you've heard, the U.S. is experiencing a maternal health crisis, and Nebraska is no exception. We are the only industrialized nation where maternal mortality is on the rise, and more than half of maternal deaths each year are preventable. In Nebraska, our maternal mortality rate between 2014 and 2018 was 37.29 deaths per 100,000 live births, 1.5 times higher than the national rate. We also can't overlook the disparities, as others have pointed out, in birthing and postpartum care experienced, especially by Black people in our state. In Nebraska, the share of births for Black people covered by Medicaid is 65%, which is much higher than that of other groups. Additionally, the severe maternal morbidity rate was 63% higher for women in Black communities in 2020 than in white communities. The legislature has the power to narrow this gap and improve birth outcomes for all Nebraska families with LB 419. When new parents have access to healthcare that they need, the chances of post-birth complications decrease, of course, as you've all heard. And when people choose to parent, they deserve to have safe, healthy pregnancies, and all Nebraska families deserve to have a healthy start. LB 419 is a common sense measure that would help Nebraska families thrive. Thank you to Senator Wishart for bringing LB 419, and I respectfully urge the committee to advance the bill to general file. And I can take any questions if you have any.
Any questions? Seeing none, thank you.
Thank you.
Anyone else in support of 419? Welcome.
Hello. Good afternoon, everyone. Thank you so much for the opportunity to testify. My name is Marielle Harding, M-A-R-I-E-L-H-A-R-D-I-N-G. I am the Senior Director of Programs and Initiatives at Nebraska Family Planning, and I am here to voice my support for this bill on behalf of our organization and our board. Nebraska Family Planning works with 12 organizations across the state to improve access, quality, and equity related to family planning services. Our partners provide a range of services, including contraception, cancer screenings, STI exams, similar services to that. We cater our services particularly to people who are low income, and uninsured. The services are provided at no cost, or they're provided on a sliding fee scale depending on the patient's income. In 2021, our network served over 20,000 individuals, with over 60% of clients reporting an income below 100% of the federal poverty line. Sorry, I'm nervous. I just walked in. This bill matters to us because it will improve maternal well-being for Nebraskans, particularly for people who face greater obstacles to achieving health, people who live in rural areas, people of color, and people who have low incomes. These are the people that we serve, and we are unwavering in our commitment to them. Family planning is an essential part of postpartum and interpregnancy healthcare. There's a greater risk of adverse outcomes when pregnancies occur less than 6 months apart, and this interval potentially lasting up to 18 months. Shorter intervals between pregnancies appear to be more common among women of lower socioeconomic status and women of color, which are communities that this bill would particularly impact. Our network and other safety net providers like us cannot provide all of the necessary services for comprehensive postpartum care. We don't have the capacity, and often our partners cannot offer the full range of services needed for postpartum care. So this means that we rely on referrals to specialists and other providers who can provide this care. However, these specialists are often inaccessible to our patients given their financial limitations or lack of insurance. In addition, awareness of our services is another important barrier to the continuity of care because integration of systems and referrals are largely inadequate or incomplete. In Nebraska, nearly 30% of maternal deaths are reported to be due to lack of access or lack of financial resources for continuity of care. This bill would remedy that issue as postpartum individuals would not be left to find a new provider after 60 days, one who would provide them with services even if they don't have insurance. At Nebraska Family Planning, we know legislation like this makes a difference. Data from our network demonstrate that in 2021, the proportion of clients who we served who were insured by public payers increased by 50%, which is a testament to the impact of the Medicaid expansion that went into effect. This is encouraging, and it's good for Nebraskans, and it's also good for our partners who can rely on streams of revenue outside of grants. On a personal note, you may have noticed when I sat down, I am soon to be a postpartum mother myself again, and this is an extremely joyous time for myself and my family. And as I think about the postpartum period, I am deeply grateful to have security in my job. I will be provided with 3 months of paid leave and security in my health insurance, which is not dependent on my income or on my maternity status. This is my second child, and following the delivery of my first child, I relied heavily on my medical team throughout that first year of motherhood. Even though I was a low-risk pregnancy, I needed supports for pain, for breastfeeding, for mental health, and for cancer screenings. We all know that I'm not unique in this, and my needs did not end 60 days postpartum. I was fortunate to have the care that I needed well beyond that date. Every woman deserves the care that they need, especially during the postpartum period. Thank you so much for your consideration. I'm happy to answer any questions that you have.
Thank you. Questions? Thanks for being here.
Thank you.
Anyone else in support of LB 419? Seeing none, those in opposition to LB 419? Anyone in the neutral for LB 419? Seeing none? You're waving. Well, we'll wave back. Thank you, Senator Wishart.
Letters. Letters for the record.
Oh, letters. Have we letters? We're scrambling for the stats and specs here. There they are. Thank you. We received 30 proponents.
32. 32.
32. Okay. I see here 30 proponents, but no opponents in the letters and no one in the neutral. Thank you so much. And this brings LB 419 to a close. Let's look at LB 65, Senator Day.
We can do 65 first.
Would you rather? Well, I think we have that listed
That's
first,
fine.
but
Yeah.
Oh, yeah.
65 is first. On the sheet.
Can we do 64 first? It just makes.
doesn't make any difference.
okay with you.
Let's,
Difference
for testifiers?
does it matter for testifiers? Do you have who you need in
We have who we
expecting?
need. Yeah, they're
Okay.
related to each other. Just it would make more sense
Great.
to have
Well
64
then,
first.
let's go out of order, darn it. We're going to do
That's what
LB
we do,
64
yeah.
because we can. Thanks, Senator Day.
Thank you, Vice Chair Harden, and good afternoon, fellow members of the Health and Human Services Committee. My name is Jen Day, that's Jenday, and I represent Legislative District 49 in Sarpy County. The first of two bills I'm introducing this afternoon is LB 64. Both of these bills are a part of a multi-year effort to create safeguards, transparency, and accountability within the childcare system following a series of disturbing instances of physical abuse against 1, 2, and 3-year-olds in a chain of childcare centers in West Omaha. Clearly, this kind of abuse happening to babies and toddlers is horrifying, but this trauma continued to extend well after it should have been exposed, and additional families were impacted only because nearly everyone involved was kept in the dark. Our work in this area began after parents contacted us and asked, first, how was this allowed to happen? And second, what can we do to prevent this from happening to other families? As a result, we have spent the last 2 years identifying the weak points in the oversight of our childcare system and working with the parents and stakeholders to identify solutions that could prevent these types of tragedies in the future. As you may recall, last year, the legislature required the DHHS Division of Children and Family Services to provide notice to the Division of Public Health Licensure, which mirrored the internal reporting processes currently done in schools and should allow licensure to more quickly spot trends within data. LB 64 is the next step in this process and would require the Department of Health and Human Services to notify parents whose children attended a child care center at the time of an incident that led to an employee being placed on the Child Abuse and Neglect Registry. This solution was a direct recommendation from parents who were shocked to learn that abuse can happen in a child care center, but under current state law, only the direct guardians of the child involved in the abuse are notified. Time and time again,
When I am talking to people about the work we're doing this session, people are surprised that this heightened level of notification is not already state law. In terms of how LB 64 would work in practice, once a case of child abuse has been agency or court substantiated and a name is added to the registry, the holder of the license would be required to provide DHHS with the names and addresses of those attending at the time of the incident, and DHHS would be tasked with providing mail notice. While this would not undo the first case of abuse in a childcare setting, it would provide parents greater transparency and context. In the cases in West Omaha, the timeline of abuse meant that notification had notification been given, it may have allowed other parents to connect dots that would otherwise not be notable. At the very least, it would prevent the situation that happened in West Omaha, where many families that had kids in daycare were not informed of the multiple cases of abuse from other families at their childcare facility until the families themselves started messaging each other about what was going on. In the legislature, there is a tendency to discuss issues in a removed and technical manner, but at the end of the day, these are our children. It comes down to the obvious reality that if our own kids were in a childcare facility and documented, substantiated child abuse had happened, we would want to know about it. It is truly sad to reflect on parents dropping their children off at daycare and not knowing that this happened when the state has this information that could be easily given to them. We all have different views on what's the best way to run this state, but at the very least, all of us, deep down, know that parents should have this information that so clearly affects the well-being of the single most important thing in their lives. So often, we get into the weeds of our state systems and technical responsibilities that we can forget that the families involved are the true core of our childcare system. At its most basic, LB 64 is a parent-centered bill that recognizes that we should never have a system where parents are kept in the dark about what's happening with their children's care. Before I open for questions, one minor note. There's a suggested technical amendment should have been distributed with the fact sheets, AM 63, which clarifies that LB 64 applies exclusively to the licensed childcare centers. The statute LB 64 was written under 434308 contained both the Child Care Licensing Act and the Children's Residential Facilities and Placing Licensure Act. That wasn't our intention. So we're just clarifying, quote, childcare licensed as described in subsection 2 of section 71-1911, unquote, to make it clear that we're only trying to apply this to licensed childcare. And with that, I am happy to answer any questions.
Thank you, Senator Day. Any questions? Senator Repeat.
Thank you, sir. In the pediatric business, we always had a challenge with maybe a divorced couple as to who had custody, who got to know, who made decisions and everything else. Does this mean that regardless of what the divorce decree says, both of the parents, biological parents, would be notified?
I don't have that answer for you right now, but I'm happy to find that out. Yep. No, that's a great question.
Well, it becomes,
sure.
Sometimes it puts the provider in a terrible
Yep.
situation. Thank you.
Any other questions? I might make a suggestion.
Sure.
As someone who owns a commercial childcare center in another state, I'm surprised to see that Nebraska doesn't, because most states, I can promise you, do have this in place already.
Yes.
I would say as many ways as this can be communicated to parents and public as possible needs to be looked at, because when there's only one way of communicating it, it's amazing how these things can get obfuscated.
Sure.
So
absolutely,
electronic communications, snail mail, jungle drums, smoke signals,
I agree.
whatever can be done.
Yep. Yep.
Right.
Thank you, Senator.
Thank you. No other questions? We'll move on to proponents. We're going out of order if you just walked in. We're doing LB 64 because we think that's the way it should be done. We'll come to 65 in a little while. But proponents of LB 64, welcome.
Hi, thank you for having me. My name is Dr. Ashlyn Turner, ASHLYNNTURNER. Thank you all for taking the time to be here today. I come to you in support of LB 64. I would like to thank Senator Day and her entire staff, as well as Dr. Katie Bass, First Five Nebraska, for their continued support of our efforts to make childcare safe and accessible for all Nebraska families. In October, I spoke with you and used excerpts from the DHHS finalized and substantiated reports to show the nature of the abuse as well as the lack of communication from both the child care provider and DHHS that allowed this abuse to continue to occur. Today, I'm going to use a timeline of events to still illustrate the glaring breakdown in communication regarding just one incident. I assure you there are many from my child's teacher that ultimately resulted in more children being subjected to her abuse unnecessarily, always unnecessary. In February of 2020, Children's Services Licensing received a complaint with allegations of alcohol and controlled substance, prohibited forms of discipline, and violations of the director requirements. On the 24th of February, 4 days later, the investigation was assigned to Child Care Inspection Specialist. On the 25th, the Child Care Inspection Specialist accepted it and immediately notified the child care facility, Rosewood Academy, that staff one listed in the allegations was not allowed to be alone with children until the investigation was complete. On March 2nd, a week later, the child care inspection specialist made an unannounced inspection visit. On the April 3rd, a month later, the case report was finalized and prohibited forms of discipline were substantiated, and the report was sent to Rosewood. At that time, they are required by law to post a written notice. Unfortunately, during COVID, the doors of the daycare center were closed, and so parents were not allowed past the entry point. Therefore, none of these notices could be appreciated by any parents, nor do any of the subsequent incidents that happened. Any parent at our facility ever saw any of these notices being posted. With that declaration, the staff who was in this particular incident forcibly holding children down on cots with blankets over their heads during nap time, as I discussed with you guys in our October meeting. That was the incident that this particular report is referencing. She was relegated to correction of approved training from outside sources with positive interaction with young children, acceptably completed online, to be due by April 17th. On May 19th, the staff completed the training and was submitted to DHHS licensing. As you can see, I'm going to jump forward all the way to December 11th. A parent confronted an assistant manager regarding the March 2020 substantiated report on DHHS licensing site after it came to light through a Facebook post of a West Omaha moms group. During this conversation, the parent specifically asked about the report, and the assistant director stated that the claims were found to be untrue, direct contradiction with the report. The teacher didn't get along with other staff members, and they reported her unnecessarily. The assistant manager or director of the facility stated that the report must be an error and incorrect because they would have fired staff one otherwise. None of that information was true. So 2 weeks later, staff one, same teacher, was officially fired after close to 2 years at the center for locking a child in a bathroom alone during nap time so that they wouldn't disturb other children. This incident was also not reported by anyone at the daycare facility, including the same assistant director who fired her on this day. This was the same person who lied directly to the parents just 2 weeks prior about staff one's substantiated reports from March of 2020. The incident was reported by another witnessing teacher and was subsequently substantiated as prohibitive form of discipline, isolating a child in a locked or closed room. She was charged almost 9 months later, and her case was closed 6 months later when she agreed to terms of diversion. There were a total of 5 children referenced in the single report from March of 2020, and not a single one of these parents was notified that their child was listed in a substantiated claim. Nor were any of the other parents at Rosewood Academy notified that a substantiated claim had occurred at our center.
And I'm sorry, Ms. Turner, we're into the red, so if I can encourage
Thank
you to
you.
wrap up in the next few seconds,
Yes.
thank you.
Thank you. So in my meetings with Senator Day, we identified this gap. This LB 64 would essentially require DHHS to notify parents because, as we have seen in this particular incident, we cannot rely on the provider to just do the right thing or be the good person. I would love to say that, but it's just not true. And so we need the state to help us bridge that gap by passing LB 64 so that the licensure units are able to notify parents. Thank you for your time. I appreciate it.
Thank you.
Take any questions.
Senator Reedby.
Thank you, Mr. Chairman. I'm not challenging your credentials. I'm just trying to learn what they are. What's your doctorate in?
I'm a veterinarian.
A veterinarian?
Yes.
Okay.
Yeah.
Very good. Where'd you go to school?
Iowa State.
That's good school.
Yes, it is.
Okay, thank you.
Other questions? Thank you.
Thank you.
Other proponents, LB 64. Welcome.
Thank you. Thank you, everyone, for your time this afternoon. My name is Beth Freidenberg, BETHFREUDENBURG. It's a mouthful. Thank you, Senator Day, for your efforts to help us better protect our children and give life to LB 64. Over the course of 4.5 years, I had 3 children attend Rosewood Academy. It felt comfortable. I had relationships with the managers and teachers that I thought included transparency, and that if I needed to know something, I would. 2 of those kids were still attending Rosewood Academy when the facility closed in March of 2021. Even after the facility went into temporary closure, I still felt that there was more, if there was more going on than the massive COVID outbreak, that I could trust that there would be communication. Seeing the TV deliver the news that the facility's owner was convicted of child abuse, and reading comment after comment on social media about this man's interaction with kids ensued immediate fear and a feeling of failure as a parent, that I didn't better protect my children. And to make it worse, I didn't know what to do next. It was in that moment that I had to sit down with my 5-year-old son and start asking questions such as, how often do you see Mr. Carl? Did he talk to you? You told me he is mean. How so? He touched you. Show me where. Did it hurt? Was he mad? What happened next? While my child wasn't physically injured by this man, he was emotionally scarred. Thank you. His entire demeanor changed, and I had to assure him that he did nothing wrong. But on the flip side, I felt like I had. This incident with the owner and another child had occurred multiple months before I, as a parent, found out about it on the news. And there was no communication to the parents about the investigation, as the facility was still on lockdown for COVID reasons. And as you heard before, where this might have been posted, we couldn't see it. With the help of other individuals who started off as perfect strangers, other parents going through this same challenge, I ended up filing another incident report against Carl Hansen based on the information that my 5-year-old had to tell me. This is a conversation I never wanted to have with him, but one that I wish I could have been educated enough to have sooner, had I been contacted immediately by DHHS. My authority and power as a parent to make a decision about my kids' care and well-being was taken away because of the lack of information. LB 64 would give parents the information that we shouldn't have to seek, especially when we don't know we need to be seeking it. We deserve this information to make the best decisions for our kids. Perhaps if I had gotten that information immediately, I could have avoided my son having an incident with the same man or my 2-year-old daughter falling a victim to an abusive teacher under the same management. Nebraska parents have a hard enough decision to make when leaving their children with caregivers to go work outside the home. We must put these protections in place to give parents the peace of mind that we are doing everything to protect our children and to hold those accountable when they aren't doing just that. Protecting our children should be enough motivation to move forward with LB 64. But if you do need another reason, it's to support the parents and getting them back to work while giving them assurances there is transparency and that if the worst case scenario happened, we will be informed to make our own decisions. We know that there is a major workforce crisis in Nebraska, but can you blame parents who can no longer trust caregivers, even the most reputable ones, and are forced to make the decision to leave the workforce to take care of their most precious and vulnerable people in their lives? I know this bill won't end all the challenges we face in child care facilities today, but it's a start. And I hope it can prevent the feeling of failure I had as a parent and give the power back to parents to make informed decisions for their families. Thank you for your time today.
Thank you. Any questions? Senator Reeve?
Thank you. My concern is how do we address it when the culprit is the one that should be doing the notification if we don't have whistleblowers underneath that particular owner or supervisor? Because obviously he's not going to self-confess. I'm saying he, I assume it was a he. Do you have ideas? I'm not expecting you to have the perfect answer. I'm just befuddled myself.
You mean how does it go from, how does it even get reported
If
initially?
he's supposed to make the notification, obviously he's not going to make that notification to families.
It should be a requirement as a facility owner.
But who would do it then?
Well, the
If there was an owner, I could see the owner would have an obligation. But if, in this case, if he owns it, he's not going to self-report that he's abusing children.
Well, in this situation, he was convicted.
But he didn't report it before. Somewhere or another, he got into a police investigation. I don't know, and I don't remember the story, so.
Right. It was reported several months prior to
Who reported it, do you know?
a teacher in the
A
facility.
teacher, okay, so someone, a whistleblower.
Yes,
Inside, okay.
absolutely.
Okay. Yeah, that's kind of a delayed response because that takes a lot of courage to step up and make that call. Whistleblowers usually get punished.
Right. And in this situation, that was definitely a threat and the reason why there were several other instances that didn't get reported.
Yeah. Thank you. Thank you for being here. Thanks for telling your story.
Any other questions? I have a couple.
Okay.
You have a kind of an interesting seat, and let me preface what I'm about to say with COVID's not an excuse, right? Did the staff kind of stay the same? Did it change? Because it looks like you were there a bit before COVID started. COVID was there, and we're reflecting back on 2021 and whatnot now. I'm just curious, was the person in question someone that had been there beforehand as well, pre-COVID, or was it a COVID hire? I mean,
The person that had some interaction with my son,
yes,
he was the owner.
he was the owner, so he was there before as well.
Correct.
Also just curious, were there cameras inside the facility?
There were cameras, but it was communicated that sometimes they just didn't work.
Oh, they just got glitchy.
Mm-hmm.
Dang 'em. Okay.
Yeah, super unfortunate.
Super unfortunate.
Mm-hmm.
I'm sorry.
Thank you.
Thank you. Appreciate it. Anyone else? Welcome.
Good afternoon, Senator Hardin and members of the Health and Human Services Committee. My name is Ivy Swoboda, IVY-SVOBODA. I'm the Executive Director of the Nebraska Alliance of Child Advocacy Centers, here testifying in support of LB 64. It solidifies that parents and caregivers whose children attend daycare are notified that there is a substantiated child abuse investigation involving child care providers who work at their daycare. The Nebraska Alliance of Child Advocacy Centers is the nationally accredited membership organization for the 7 child advocacy centers, or CACs, we call them, which serve children, families, and the child protection system in all 93 counties within our state. We're dedicated to enhancing the response to child abuse. Our CAC members provide trauma-informed services to children and families during and after investigations of certain types of child abuse. And we serve over 7,800 children statewide in 2021. For those seen at our centers, our CAC advocates made over 30,000 contacts throughout that year. That's 30,000 contacts our CAC advocates made to support the children and families throughout investigation and the legal process. These advocates worked with the caregivers to answer questions, provide resources, offer guidance, and make referrals to counseling and medical care. Parents whose children have gone through any type of abuse or witness to abuse need this type of support. As you've heard today, what it was like if you didn't know that your child was even subjected to abuse. CACs understand the impact from child abuse, sexual abuse, and serious neglect that happens in institutions that are supposed to be areas of trust. It does not end with just the victim and their immediate families. All caregivers, parents, and children who are involved in the trusted institution are impacted. Signs of child abuse can be different in young children and difficult to detect. So having this notice brought forth by LB 64 may help put pieces of information together for the parents. If a child was subjected to or witnessed to abuse, the signs could vary. It could look like unusual fear of certain people or places, reluctance to be alone, changes in mood that could include anger, aggressiveness towards the parents, siblings, pets, withdrawal, changes in attitudes towards the child care center, lack of interest in friends, unexplained headaches or stomach aches. We're fortunate to know that protective factors can reduce the adverse effects of the trauma. Certain factors such as proximity to the event, prior history of trauma, family and community factors, severity of the event, though most importantly in what we're talking about this afternoon, the caregiver's reactions. So having knowledge of what has happened or that something had happened at the center, parents then have more factors in place that they can be able to respond to the impact of that trauma. So notification would prepare our caregivers. It would prepare them to get the resources and support that they need. LB 64 ensures that all parents and caregivers would receive notice when an employee of that licensed child care facility is entered into the central registry for substantiated cases of child abuse or neglect which occurred at the facility. This protects families, caregivers, and children attending the caregiver center from being further traumatized by hearing information after the fact, from the news, from sources that could lead to misinformation, which could further exacerbate the trauma. Unfortunately, in the past 5 years, there have been several higher profile cases in Nebraska at daycare centers where parents and caregivers were not notified about what happened and were left wondering if their child could have been impacted. Nebraska Alliance understands that most abuse and neglect does not happen within the child care setting, but believes fostering transparency surrounding abuse and neglect is imperative to hold child serving programs accountable for the safety and welfare of the children in their care. So we thank Senator Day for introducing this important bill, and we respectfully request that the committee advance LB 64.
Thank you.
Yeah.
Questions? Seeing none, we thank you. Anyone else in support? LB 64, for those who've joined us, we're going a bit out of order on your sheet. We're doing 64 before we're doing LB 65. We're numeric that way.
Yeah.
Hi.
Hello, Vice Chair Hardin and members of the Health and Human Services Committee. My name is Dr. Katie Bass, spelled K-A-T-I-E-B-A-S-S, and I'm the Data and Policy Research Advisor representing First 5 Nebraska. First 5 Nebraska is a statewide public policy organization focused on supporting policies that promote quality early care and learning experiences for young children in our state. I am here today to testify in support of LB 64. And I want to thank Senator Day for introducing this legislation and for reaching out to First 5 Nebraska when the parents who testified today approached her with their concerns. This past interim, LR 266 examined the notification processes around child abuse and licensed childcare, revealing gaps in who receives information and when. LB 64 creates a notification requirement for parents whose children attended licensed childcare where abuse or neglect occurred. The notice would be mailed by the Department of Health and Human Services after the abuse has been substantiated or found to be true by either NDHHS or the court. It would not provide information about the type of abuse, victim, or perpetrator, but include the date the incident occurred. The NDHHS Serious Injuries and Death Report indicates 3 to 6 cases of substantiated child abuse in licensed childcare per year from 2017 to 2021. The goal of the notification is twofold. First, this notification empowers parents to make informed decisions about their childcare. The vast majority of licensed childcare providers in our state would communicate with the parents of children in their care about any investigation or allegation as serious as child abuse. And the notification we are talking about today would serve as a closure to that conversation. However, as we have learned today, there may be situations where that information is withheld from parents. This notification requirement would ensure all parents were aware of the abuse or neglect. Second, one of the more disconcerting elements of abuse allegations in childcare is that the children involved may be too young to communicate what has happened to them. A parent may notice behavior changes in their child that concern them, but assume these changes are related to growth and development or changes in routine. For a parent in this situation, receiving a notification about a case of abuse may be reason to ask more questions about their own child and their experiences. Parents seek out childcare that is licensed because they know that licensed providers are held to a high standard in Nebraska and that there is oversight of those standards. When an incident as severe as child abuse and neglect occurs in licensed childcare, that oversight should include direct communication from NDHHS to parents. Thank you for your time today and for your consideration of LB 64, and I'm happy to try to answer any questions you may have.
Thank you. Any questions? Seeing none, thank you.
Thank you.
Anyone else in support of LB 64? Any opponents to LB 64? Anyone in the neutral for LB 64? Senator Day, will you bat cleanup?
Yes, I will. Okay, so I just wanted to answer a couple of questions. Your question, Senator Reapy, about notification to parents depending on a custody agreement. It would depend on who was required to be on the licensing agreement, or there's something that we have to clarify there. But I will for sure get you an answer. I would assume that it would depend on what the custody agreement was between the parents and who was on that agreement. But I will get you a for sure answer on that later.
Thank you.
I also wanted to clarify that this would not apply to any false allegations. This would only apply to substantiated cases of child abuse. And then also your question, Senator Reapy, about who does the reporting. So I guess I need to maybe clarify your question. Are you asking who is initially reporting the abuse or who is contacting the parents?
I was concerned that the fox who's supposed to be guarding the chicken, or, is the one that's the culprit,
right,
is also in charge. And so had then not one of the teachers or trainings reported him, it would have never happened.
Right.
So
Okay, so I understand your question a little bit better.
he
So
really has a conflict of interest. He can't do the right thing.
Sure, right. And I think this case, in terms of the owner being the culprit, was a piece of the puzzle in terms of it had gone on for a really long time, and many of the folks that he had hired underneath him were also abusing children. And so it sort of created an environment and a culture of this at this center. This is a unique situation. And obviously, Senator Hardin, as an owner of a childcare center, this type of center, I think, is the outlier when it comes to childcare. Most childcare center owners and the people that work there care very deeply for the children that they care for. And so I don't think that this is an example of what happens every day in childcare centers. But in addressing what happens systemically at the center, we noticed some places systemically as a state where we were not doing our due diligence and making sure that parents were aware of what was going on so they could protect their own children. So, the initial abuse can be reported by another teacher or by a parent or anyone even. And so I'll talk a little bit about the owners self-reporting child abuse in their own centers in my next bill, LB 65. So we'll discuss that there. But I did just want to mention that, again, we know the overwhelming majority of childcare center owners don't perpetrate this kind of abuse in their centers, and neither do their workers. We just want to make sure that in the incidents of it happening, that we as legislators are making sure that we're putting the backstops in place to prevent it from happening again. And then I also wanted to mention, so that's where the fiscal note comes from on this bill, is it would create 2 FTEs, I believe, within DHHS to handle the notification that goes out to the parents. And also the level of substantiation that this would require is the highest level of substantiation. So it's going to take a significant amount of evidence to require this type of notification to parents. And then the last thing I just wanted to mention is I know you have experience on this committee from previous years, Senator Reby, but I know Senator Ballard and Senator Hardin are new to this committee as a whole. We've been working on this for several years. I had meetings with these parents a couple years ago before bringing bills last session. We had an interim study on this, and they have told their stories dozens and dozens of times to law enforcement, to us, to the committee, to the press, and they continue to be really helpful and being willing to come here and continue to share their stories to try to protect other families' children. So I'm just really thankful for that. I'm happy to answer any further questions.
Thank you. You can react to this. My understanding is under the law that we're all required if we suspect child abuse. So that automatically gets reformed. Now, my problem with this is if that's already in statute, in place, that should be covered. I'm going to be concerned about the additional of 2 FTEs, which to me translates into $250,000 for more of the same. Now, a little background, when I was at Children's Hospital, one of my accountabilities was 8 child care centers. And I guarantee you, if I had a problem, I didn't call DHHS, I called the Highway Patrol, I called the law enforcement. I'm not going to the middleman, I'm going to the bottom line because I want to investigate. It's that serious. Would we notify the parents? Absolutely. And we didn't have any problems, but we didn't mess around with it.
And I agree.
Because our reputation was on the line.
Sure, and that's what most people will do. We did run into some discussion with the families about the fact that everyone in a child care center is a mandatory reporter.
Absolutely.
There was a
And
lot
teachers.
of, and teachers,
virtually
yes, right. Unfortunately, the cases where people are mandatory reporters and they don't report things, it's not being enforced. It's very rare in the state of Nebraska that someone who is a mandatory reporter is prosecuted for not reporting something. Unfortunately, that system's not working.
Is the state or Department of Health and Human Services already in these child care centers because they're setting staffing standards?
Yes,
Well,
of course.
And I'm afraid we used to have problems in the nursing home business that one group would come in and set the standards, the next group would come in and not give us any money to do it. Both of them state employees.
Sure.
I used to say, why don't the 2 of you ride down in the same car together and figure this out?
Yeah, and I think we all know sitting on this committee, you've had plenty of experience with DHHS. We're certainly not saying that they're the
It's a result
solution.
of gray hair.
Yeah, we're not saying they're the solution to anything, but we are saying that there isn't currently a mechanism in statute outside of being a mandatory reporter that says if there is a substantiated case of child abuse at a child care center that anyone has to notify anybody. And we are just attempting to close that loophole to provide another guardrail for kids' safety.
But my argument would continue to be, it's already staffed, it's already funded. All they're gonna do is pick up the phone and call the highway patrol to get.
But this, yes, this has
Because
to be.
it's a criminal offense.
Yes, and that's the case of, that is what happens before a case is substantiated, right? So
Well, that's what the investigation's over.
that's what the investigation is for. Then the abuse is substantiated, and then that leads to the requirement of notification.
I see it as a middleman.
They
I
would
wanna go-
actually be
I
like
wanna
the
go
last.
straight to the investigation.
Yeah, right,
because
and
it's-
that would continue to happen. It's just, we're saying after the investigation, because even in these cases, after an investigation, parents couldn't get any information from anyone. They couldn't get information from law enforcement. They didn't even know if their own kids were involved in any of these cases. There was no way for them to get any information. And again, we found out that there was no procedure to notify any of these parents. And I feel like as a lawmaker, knowing that that's a problem, again, as Senator Hart mentioned, as an owner of one of these centers, parents need to know. I have 2 kids, and I know how difficult it is to drop your kids off at a childcare center, trusting a stranger essentially with the care of the 2 most important things in my life. And that's a really difficult thing to do. And in order to be able to really trust those people even more than we already do, we have to have a mechanism as a state to make sure that we're taking care of those families.
I would want to hear what, maybe it's the Attorney General's opinion, so that we don't mess up the investigation.
Sure, and we can
There's
clarify.
protection innocent until proven guilty, so.
Yeah, no, and we're not
I would
trying to.
almost like to have.
And that's why
him
that's
say,
why.
this is how much you can inform, or.
Yes.
And I think they need to inform the parents that there's something going on, but because of the investigation, we can't speculate on
Right, and
what's going on.
this wouldn't be in the middle of an investigation. This would be after the investigation. This would be a substantiated case of child abuse. This isn't an allegation.
I don't mean to be argumentative.
No,
simply
I'm
give
not.
the
I
investigation
no, I
report.
understand.
Here's a copy of it. 10
Yeah.
cents, you can make a copy.
Yeah, and sometimes it's not that simple because the owner, again, in this situation, the owner didn't want anyone to know. So there was because law enforcement was too busy trying to do their own thing, there was no way for these parents to seek any information. And when they contacted DHHS, DHHS was saying basically that they couldn't do anything. They're not required to do anything.
And you're saying these 2 new people are going to be able to say they can?
I would hope that we could at least make an effort to try to make that happen instead of just shrugging our shoulders and looking at child abuse that's happening systemically in child care centers and not do anything about it.
Well, I think we're all in agreement. These kids need to be protected. So.
Thank you.
If I can just interject for a moment, and page 3 of the bill, line 14, has a little phrase right there. It says, for each person entered into the central registry. That grabs my attention because that's the part, I think there's a big communication thing that goes on between agencies.
Right.
In a nutshell, usually if something bad happens, and sometimes bad things happen out there bumping into other humanity, but yes, there's law enforcement to be notified. There's licensure to be notified. There are, probably 4 different organizations to be notified. And in that process, there becomes a question of who's communicating with whom. And so that's my sense, is that the central registry piece is very important. And the problem is a lot of times no one knows to look to the central registry, if you will. It's there, no one's hiding it,
right?
But we simply don't know what we don't know.
Right.
And so that's also really important, not only for other parents, but for other child care centers who may in the future hire that abuser.
Exactly.
So just saying hypothetically.
Yeah. Which has happened.
Right.
Yes.
It does. How else do you know?
Right. Thank you.
Thank you. Well, I know. Let's look at LB6. Wait, we have a few more. We have some letters that came in. 4 proponent, 1 opponent. Just
check
on LB64.
Unless somebody
Thank you, Senator Day. Senator Day will ask you to stand up and turn around and sit back down again for LB65. Welcome, Senator Day.
Thank you, Vice Chair Hardin and fellow members of the Health and Human Services Committee. My name is Jen Day, that's Jenday, and I represent Legislative District 49 in Sarpy County. The second part of our package of bills is LB 65, which has two primary components: a change that creates a new classification for self-reporting of licensure violations, and a notification requirement when DHHS takes discipline against a child care center following licensing violations. Like LB 64, the idea for LB 65 grew out of the work over the interim on LR 266 when it was identified that there were limited requirements for parental notification of licensure violations, and child care centers that were self-reported were categorized as the same, child care centers that self-reported were categorized the same way as those that were reported by a third party. So LB 65 is about aligning incentives in a way that would better encourage providers to report minor self-violations of their licenses. Because licensing investigations follow a license, not a person, under current law, providers may be disincentivized to report an action from their employees for fear that it will reflect poorly on their license. Beyond encouraging license holders to report, changing this designation should provide helpful context to those accessing the information as well, since there is a genuine interest in intent between a self-reported violation and a third-party reported violation. I think everyone can agree that honest mistakes do happen in the workplace, and a provider that has the willingness to self-report should be treated in a slightly different manner than one that isn't. Additionally, LB 65 would mirror the parental notification in LB 64, but this time for licensing violations that are serious enough to merit discipline from DHHS. So while LB 64 deals with the individual employee, LB 65 would create the same framework of notice, but for the license. Under LB 65, in the event that a licensing violation leads to the Department of Health and Human Services taking disciplinary action against a child care facility, LB 65 would require the department to provide notice by mail to all parents and guardians of children attending a child care center. However, this reporting requirement would not apply to minor violations where HHS may choose non-disciplinary corrective action or licensing agreements with child care providers. So under LB 65, only the most serious of licensing violations would rise to the level where parents are given notice. The processes for this notice are the same as LB 64, where the license holder is required to provide DHHS with the names and addresses of those attending at the time of the incident, and DHHS would be tasked with providing mail notice. The constant with LB 64 and LB 65 is an effort to increase transparency and empower parents with information that they deserve to have about their child care provider. As I said in LB 64 as well, parents have the right to know what is going on in their child care center. In the rare instances that these serious violations do occur, the process for letting parents know should be transparent and provide them with as much information as possible. Both of these bills follow the general principle that if these incidents happen in a facility our children attended, we would want to know. So it is my hope that we can prevent future tragedies and empower Nebraska parents by making these notification changes in LB 65. And with that, I'm happy to answer any questions.
Questions committee? Seeing none, will you stay around?
I will.
Wonderful. Is there anyone who is a proponent of LB 65? Welcome to our merry crew.
Good afternoon. My name is Melissa Krajewski. I want to thank Senator Jen Day for continuing to pursue necessary changes through legislative measures. Thank you to this committee for giving parents the time and space to share their experiences. My testimony is unique in that, to my knowledge, I'm one of the only parents notified of child abuse in this daycare setting. This was not one daycare, but 3 separate locations, with child abuse allegations at all 3 facilities. I was notified by Child Protective Services
on December 31st, 2020. The CPS worker stated it was witnessed and reported my child was rough handled. She continued to say rough is subjective. In what rough is to one person may not mean the same to another person. I asked when this occurred. She stated December 16th. She stated there was an investigation and did not have any additional information she could provide. When we spoke with the owners and the management after the holiday closure on January 4th, they had completely different stories. The owner stated, "This didn't even happen to your son. The teacher wasn't even in the same room as your son." He told us a cautionary tale of another incident that occurred long ago at a different location where workers accused another worker of coming to work while on the influence of a medication that impaired them. We didn't realize at the time he was telling us of the Southwest location incident. The state had investigated, substantiated claims, and never informed parents of the investigation. He claimed high school drama. Although he stated it happened a long time ago, the incident occurred 10 months prior. I was not aware of the DHH website at this time. When a neighbor informed me of this, I didn't know how to properly search the website in order to get the information I was looking for. The director, the owner's daughter, however, stated yes, the incident did occur and it did happen to our son, calling it a teachable moment. When they did not inform us because no injury occurred. Between the conflicting information from the daycare and the CPS worker's statement, rough handling is a subjective term. We decided to use the daycare for the following month while we waited for new child care to have an available spot for us. CPS, the owners and director, reassured us the individual would not be allowed to be alone with children during the course of the investigation. This proved to be a false sense of security. Over the next 3 weeks, there were constant red flags. Why was the worker allowed to diaper changes, a one-on-one activity? Blowouts, unchanged dirty diapers upon pickup, bright red face upon pickup, marks, light bruises, which led to the final pickup on January 26th, when we noticed 2 welts on his abdomen near the bottom of his ribcage. We are not made aware by the state, but later realized this was the same day CPS notified the daycare they faced disciplinary action for the December investigation. I called the CPS hotline to report this immediately, and they sent an officer to our house to take a statement and look at the welts. The following day, a CPS worker arrived to take a statement and look at the injury. We took our son to the doctor for a medical examination. The director informed us, due to the allegations we made with CPS, we were no longer welcome at the daycare. I can't begin to explain how I would have never allowed my child back to that facility. Later, the police officer arrived at our house with a crime scene photographer to take photos of the injury, which no longer appeared as welts, but scabs. When I communicated with DHHS about inconsistencies in previous injuries, I was met with dismissive responses. Doubt started to set in. What if I was wrong? No one wants to believe that their child was abused. My greatest fear was that we move on to another daycare and this worker continued to abuse children at this facility. I was terrified to speak out for fear I was incorrect. I was terrified the ownership would pursue lawsuit against me for defamation. This was a highly regarded daycare, one that no one would have believed such claims. I was contacted by the Omaha Police Department investigator mid-February. It seemed to be out of the blue. I spoke with them over the phone and thanked them for their time, as I had not heard from CPS in weeks. I later realized this was the same time frame parents at another location were being informed it was witnessed and reported their child was dragged across the floor by his ankles by the owner himself, and yet another mother filed a police report for an injury she noticed on her infant's head. When individuals started posting their stories in early March 2021, I realized the scope, scale, and magnitude was much larger than anyone could have imagined. This is when the 3 locations voluntarily closed. For the course of the investigation, and parents were notified there was an immediate threat to the safety of their children. The weight of this and the guilt I felt for not sharing my experience previously was unimaginable. Change is desperately needed. My greatest fear is that in a few years, a new group of parents will be sitting in front of you with similar stories to take action. I urge you to take action now. To provide a clear understanding of how to proceed in the future, our children's safety and welfare depend on it.
Thank you for your testimony. Are there any questions from the committee?
Please drop-in centers?
No.
Okay.
Yeah, we had been there for just over a year at the time. And the only day that we never had a report was the day that our son was abused. They didn't have a daily report that day. I didn't realize until probably a couple weeks later when CPS called me. It was the only day in their care that they didn't say who was in direct care of our children or our child.
Thank you. Any other questions? All right, seeing none, thank you.
Thank you.
Hello,
Good afternoon.
my name is Amanda Sway, AMANDASWAY. I would like to thank Senator Day for working tirelessly to introduce LB 65. December 16th, 2020 and March 30th, 2021 are 2 days my family will never remember, never forget. December 16th, 2020 is the day my youngest daughter was born. It was also the day that my oldest daughter was abused at Rosewood Academy. March 30th is the day that we were notified by another parent of the abuse. It was 104 days later. The next 2 days were extremely confusing because I was forced to find all the information myself. I called into DHHS and referred to different people in different departments, all without much help as to what happened that day. There's no handbook that's given to you when you have children on how to handle the situation, and unfortunately, parents don't know a lot about these departments and their responsibilities. There are 2 investigations with my daughter's incident, one by the licensing department and one by CFS. After many phone calls and many people passing me off, it was finally confirmed that my daughter was associated with the reports that were substantiated by the licensing department. Because the committee has changed, for reference, my daughter was 1 at the time. The teacher became frustrated with her. She pulled her feet out from underneath her. She fell back and hit her head. She couldn't talk to us. She didn't tell us what had happened. But around the end of March, our daughter started saying that she had fallen and hit her head, and we didn't know about it until that time, and that's when the warning signs started to happen. When speaking with the individuals of the CFS department, they said my daughter was not associated with any child abuse reports because only 1 child needs to be named on those as abused on those reports. In my daughter's case, there were 6 children that were impacted and only 1 of the parents were notified. CFS and licensing were classifying that the form of abuse that happened to my child were inappropriate forms of discipline. And there's a contradiction on whether that was abuse or if it was just inappropriate forms of discipline. Because of that, that's why CFS never notified the local law enforcement as to what was happening in my daughter's situation. Because of the disputes between the 2 reports and the lack of support provided by DHHS, I decided to file a complaint with the police department to make sure that it was documented somewhere outside of DHHS. At the time, the police department had never heard of my daughter's situation. Within 5 days of me reporting it, the teacher was charged with 1 count of misdemeanor child abuse. As we all know now, she pled down to 1 count of disorderly conduct. How DHHS licensing, as you've heard today, does it now. When a license is disciplined, they are required to publicly put a note for everyone to see it. In my daughter's situation, we never saw the note. Rosewood had a system where we dropped our children off at the front door and we were not allowed in due to COVID. Because of that, Rosewood could have very well been compliant, that it was noticed, was published in a public area, but we as parents were not able to see it. Currently, there is no follow-up set up by DHHS on whether these notices are even put up. A notification system is needed to ensure that everyone is held accountable, and not only assures that we as parents can know what's going on behind closed doors when we are not there, but it also helps the state keep track of the multiple offenses. After all of this has happened, I can tell you that most parents do not know that they can sign up for an email that is sent out monthly regarding licensing violations. Most parents don't know the departments within DHHS and what their roles are in the big picture. And by adding a system that automatically notifies the parents of this incident, you are not only providing needed information for the parents to make the best decision for their children, but you're also providing the opportunity to provide insight to what happened, who they can call, and what the report actually means in a timely manner. I pray that no other family has to go through what my husband and I did when we read a report and we had to try and choose which form of abuse we would be okay with, only to find out that my daughter was physically hurt. I pray that no other family has to wait 104 days to know what's going on behind doors. And lastly, I pray that you want to join us in helping us make an impact that Nebraska needs. Thank you.
Thank you. Are there any questions from the committee? Yes, Senator Repeat.
I just tried to briefly read your letter here, and it seems to me that there were 2 investigations going on. I'm kind of curious, like, what's that like in medicine, a second opinion? And yet, quite frankly, in your letter, I believe, correct me where I'm wrong here, is that it appears to me that DHHS was totally incompetent. And so subsequently, you had to call the police. I'm kind of going like, so if we had 2 more FTEs, we're just compounding the incompetence. That's my concern. It's not, it's a matter of, I think, process and recognizing the significance of the issue and the timeliness of it all, not how many people you can get involved at the table. I just find it frustrating with DHHS. I would tell them that if they were here.
It is. It's extremely frustrating. And just to clarify that, DHHS has the 2 department. One goes under the licensing to ensure that they are licensed and can provide childcare. The other one is investigating the child abuse allegations.
Yes.
And in our situation, DHHS never classified it as child abuse. They classified it as like incorrect disciplinary action. Therefore, they didn't have to send it to the state or the police department. And that's why they were never notified of my daughter's situation.
Well, maybe rather than 2 FTEs, we need to give them 1 telephone and a free breakfast together or something. I don't buy this, that, we have these silos and we refuse to talk. There's children at risk on this thing, and timeliness is everything. I'm sorry.
For reference with that too, my daughter, like I said, was born the same day. So we did see and experience a lot of
This is daughter number 2, baby.
my second daughter, yes. But we experienced a lot of change within our oldest daughter. She would no longer be with family members alone. She would no longer go with our friends that we hung out with on a weekly, multiple weekly basis. She was extremely attached to me and my husband. Drop-offs at the daycare were extremely difficult, and the warning signs that we were seeing, we associated it with adding a new child into our family and not abuse. And then, like I had said before we had found out, she had started speaking more in those 3 months, and she said, I hit my head. It had gotten to a point that even after the daycare had changed, we had to change how we drove around the city, because every time she saw the facility, she would say, Mommy, I fall and hit my head. I fall and hit my head. So we had to stop driving by it for a month to so she could forget about it.
Thank you. Thank you very much.
Any other questions? Yes, Senator Hardin.
I asked this question of someone earlier. Any cameras?
There were cameras. From what I understand, they recycled the recordings after 2 weeks. This is 104 days later.
So in essence, there were no cameras.
Exactly.
Thank you.
Yep.
Any other questions? Seeing none, thank you for your
Thank you.
testimony. Take the next testifier in support. Welcome.
Thank you. Chairperson Senator Hansen and members of the Health and Human Services Committee, thank you for allowing me to advocate in favor of Bill 65 today. My name is Dr. Betsy, B-E-T-S-Y, Tonniges, T-O-N-N-I-G-E-S, and it's in educational leadership, Senator Reapy, if you want to know. And I reside in Lincoln, Nebraska. I'm a parent, a former educator, school administrator, and now currently own and operate a private primrose preschool here in Lincoln, as well as operate a primrose school that will be opening this spring in collaboration with the prominent sports tech business here in Lincoln. Thank you to Senator Day for thoughtfully and intentionally introducing this bill. My passion for early childhood came when I realized as a teacher and building principal and knowing by age 5, in many cases, it becomes an uphill battle to undo or heal the effects of birth to age 5 that many of our children experience. In 2016, a federal study completed by the Center for American Progress found that an estimated 50,000 preschoolers had been suspended in 2015 alone, and 17,000 had been expelled across our nation. If you consider it, that equals to be just about the same amount of students Lincoln Public Schools serves in our community on an annual basis. The number is shocking. Add in a global pandemic and dwindling supports for students due to lack of staffing, lack of staff with qualifications, and a larger number of students with special needs or students who need testing for supports, and that number has drastically increased. Furthermore, research also shows that young children who are expelled or suspended are as much as 10 times more likely to drop out of high school, have adverse feelings about school, and as a result, more likely to end up in our jail system. Our students are coming to us with more needs now than ever, and yet supports to providers in both nonprofit and for-profit in the early child care sector remain stagnant, and in some cases has decreased substantially. The rules and regulations for DHHS reporting features have not adjusted to allow for centers to work with families who are facing challenging times. It is easier for a center to dismiss a student than to work with them for fear of having to report a violation to licensing. Regardless of the planning, being proactive, and reporting the violation themselves, a licensing infraction reported by a center, just out of honesty, is treated just the same as a center who is negligent in their practices and is reported by somebody else. Therefore, I'm advocating for the DHHS complaint tracking system to differentiate between self-reported and complaint-related licensing violations as outlined in this bill. For child care centers to better serve families with students who have special needs, a collaborative plan needs to be in place. Even the most well-crafted plans established collaboratively between the family and a center and sometimes external providers have an element of trial and error as everyone works together to establish a safe plan for all that is involved. For example, a child who has a disability and as such has a history of eloping or leaving the classroom without permission due to too much stimulus. Under current licensing practices, the minute that child leaves that space, the center is required to call licensing to report that a child was out of eyesight and earshot of an adult. If the teacher in the classroom is by himself or herself, this requires them to decide whether to leave the remaining students in the room alone to follow the one who is eloping, or call for help for someone to go after the child who has left the space. Either way, a licensing violation has occurred. We will honestly report it. The experience is logged into the system and an investigation ensues. There is nothing currently on the website that would detect to a citizen that the center had an established plan in place, that the plan was collaboratively planned with the parent and signed off on with the parent knowing that this could happen. If LB 65 becomes law, it does not mean that the situation above would not be reported to licensing or even listed as a licensing violation, but it does mean that the complaint tracking system would provide that critical piece of information to the public, that our child care center was proactive in communicating with licensing and was honest about their practices. We do not want a situation where centers are deciding whether or not to be honest or pretending something didn't happen for fear of public retribution, which does happen. We also need to know that we need to do what we can to encourage our child care centers to focus on the needs of their students instead of the liabilities. In closing, an ounce of prevention in early childhood could change the trajectory of our prison system as a whole. It starts with asking for help instead of fearing retribution. It also starts with centers being supported in working with families of students with special needs to be able to keep them in a stable child care environment. This change in legislation and reporting would provide support to centers who are so hoping for support and encouragement, where child care providers are needed now more than ever. Thank you for allowing me to share my expertise, experience, and hope for assisting child care providers in our state. Our profession is essential to economic growth and to support many of the initiatives introduced during this session. And I ask that the committee please advance this bill as a parent and as a child care provider. If you have any questions, I'll take them.
Thank you for your testimony. Are there any questions? Yes, Senator Reapy.
Senator, thank you, Mr. Chairman. My question is that you're obviously an entrepreneur, but what's your doctorate in?
Educational leadership.
Oh, okay, very good. I just wondered if you were a chemist or something like that.
No.
Okay.
Mm-mm. I mean, some days it, feels like it, but no.
Thank you very much. Thank you for me.
Any other questions? All right, seeing none, thank you for coming.
Thanks.
Take our next testifier in support.
Hello again, Chairperson Hansen and members of the Health and Human Services Committee. My name is Dr. Katie Bass, spelled K-A-T-I-E-B-A-S-S, and I'm the Data and Policy Research Advisor representing First 5 Nebraska. Our organization is a statewide public policy organization focused on supporting policies to promote quality early care and learning experiences for young children in our state. And I'm here today to testify in support of LB 65, and I want to thank Senator Day for introducing this legislation. During the LR 266 interim study this past summer, concerns were raised about investigations of licensing violations that may be serious but do not rise to the level of a child abuse investigation. In instances where a licensing violation has been documented and the result of the violation is one of the statutorily defined disciplinary actions against child care providers as outlined in Nebraska Revised Statute 71-1920, there is no statutory requirement to notify parents. LB 65 requires the Nebraska Department of Health and Human Services to provide notice by mail to all parents and guardians of children attending licensed childcare when there's a disciplinary action against the childcare license. To be clear, there are many different types of licensing violations that can range from needing to caulk a toilet to inappropriate use of discipline against a child. This legislation would not require a mailed notice for every documented violation, but only those serious enough to lead to the issuance of a probationary license, the revocation of a license, a civil penalty, or restrictions on enrollment in services. This notification empowers parents to make informed decisions about their child care. It also encourages dialogue between the provider and parents about how the violation either did or did not affect the child or the care their child receives, and what is being done to remedy this violation. A second element of LB 65 is adding information to the complaint tracking system for licensees under the Child Care Licensing Act. Again, this is part of our conversations with providers during the LR 266 interim. In discussions with our child care providers, they expressed frustration because it was difficult for parents to differentiate between the self-reported violations from complaint-related violations. For example, if a child care business owner learns of an employee who used inappropriate discipline against a child, they are obligated to report the incident to child care licensing and may take actions up to and including firing the offending employee. However, the incident is tracked as a violation against the business owner's child care license. LB 65 would not change this, but would identify when a violation was the result of a self-report as opposed to a complaint. This additional piece of information is important to providers and prospective and current families as they educate themselves on their child care options. Nebraska is fortunate to have early childhood educators who make children's safety their top priority. But when safety concerns do arise, it is important that we are transparent and accountable to parents who are entrusting their children to the care of others. Thank you for your time today and for your consideration of LB 65, and I'm happy to try to answer any questions you may have.
Yes, Senator Repeat.
Thank you, Mr. Chairman. My repeat questions. Katie, what's your doctorate in?
It's in sociology from the University of Nebraska, Lincoln.
I'm starting to feel like a real underachiever. All the doctorates there. Thank you very much.
Thank you.
I don't have any questions.
Any other questions from the committee? I think I have one.
Yes.
It might be because I just missed Senator Day's opening.
Sure.
I hope I should say this. So we're talking about complaints now, right? Not self-reporting?
This legislation has two pieces to it, right? So one is that it's part of the complaint tracking system.
Yeah.
So any licensing violation that is entered into the complaint tracking system, it would need to just state whether or not it was self-reported or complaint related. The second piece of the legislation is when there are licensing violations that result in discipline against the license, there would be notice to parents. So only those disciplinary actions that are outlined in statute,
Okay.
not corrective actions, not some of those smaller events, but when we have larger events that would lead to probation or a civil penalty, then there would be notice
So
to
verified
parents.
offenses, not just
Verified, that's
complaint-driven
correct.
offenses. That's the only thing I was worried about is like, you might have a disgruntled employee who doesn't like their boss and they end up calling in and saying, oh yeah, there was a kid I heard, who got pushed down, all the time.
Right.
Now it's a complaint and all the parents get notified and the business owner gets, so, but it has to be followed up and verified. However, if somebody still does complain though, it still has to be tracked though.
It does have to be tracked, right? And this would add an additional element. So all of the complaints in the complaint tracking system, when there's an investigation, they'll state whether they're substantiated or unsubstantiated.
Gotcha.
That's already in there.
Okay.
But we're also adding, because there could be substantiated events, violations that did happen, right? As Dr. Tonages gave an example of elopement, right? That was certainly a violation that occurred. So that would be substantiated, but this would also indicate that that substantiation was the result of a self-report, that the license was the one who notified DHHS this happened.
Yeah, 'cause I was wondering, make sure not some way that people can abuse it,
Right.
or use it against somebody in a nefarious situation, so.
We wanted to be really cautious of that, and I think Senator Day has been very cautious of that in the crafting of this.
Like, yeah. Okay, thank you for answering that.
Oh, quick question.
Yes, Senator Ricky.
Thank you, Mr. Chairman. You used the word investigation. I
Yes.
have a bias. When I think of investigation, the people that have the most experience in investigations, law enforcement.
True.
And it is a breach of the law, a violation of the law, if it's confirmed. So I feel more comfortable of having law enforcement making the quote unquote investigation than I ever would the Department of Health and Human Services.
Sure. I think what we're talking about here, though, are violations of the licensing agreement, right?
Oh, okay.
And so it'd be an investigation of the licensing
Okay.
agreement.
Okay.
Now, I know when you're talking about some of the other things, right, we have
Okay.
other types of investigations, but here we're focused on
I
the
was
license.
out of word. Thank you. I
Yes.
appreciate it.
Okay, any other questions? Just make sure. Seeing none, thank you.
Thank you.
Is there anybody else who wishes to testify in support of LB 65? Seeing none, is there anybody who wishes to testify in opposition to LB 65? Seeing none, is there anybody who wishes to testify in a neutral capacity? Seeing none, is there a date? Come back up to close.
Thank you, Chairman Hanson, and I appreciate the engagement from the committee on this issue. Again, we've been working on this for years. The decisions that we made about these bills were from the years of discussions and research that we've done, from the interim study that we did. Again, we tried to balance protecting our providers in the community and make sure that we weren't penalizing them to a point that they wouldn't be able to operate, but also protecting the kids that are in the centers and making sure that families are notified of instances that they need to know about. The main concern with 65 was to differentiate between self-reporting and third-party reporting, because we felt like when there was no differentiation, we were disincentivizing owners of centers to self-report these incidences. And as I mentioned on LB 64, the incidents that this all arose from came from an issue that was sort of a systemic issue. And this, in differentiating the two different types of complaints, will help to hopefully address the systemic issues that could potentially arise from an owner who doesn't self-report, and then that leads to other issues within the center. So again, as I said earlier, these families have told their stories dozens of times. They've had to bear their trauma of their children being abused, to us, to law enforcement, to media, and I am grateful for them continuing to show up and work with us on these bills and to trust us to help make sure that nothing like this happens to kids, other families' kids in the future in the state of Nebraska, and that we're doing our best as lawmakers to be sure of that. So, thank you.
Thank you. Are there any questions from the committee? All right, seeing none, thank you very much. That will close, actually, before we completely close it, let me read that we did have 3 letters come to us, 3 letters in support and 1 in opposition to LB 65. And also, I don't know if they read them or not, but 4 letters of opposition, or 4 letters supporting LB 64 and 1 letter opposed to LB 64. So with that, we will now proceed on to LB 115, and welcome Senator Raybould to open.
Good afternoon, colleagues. It's so nice to be with you all today. My name is Jane Raybould, and it's spelled JaneRaybould. And I represent Legislative District 28 in Lincoln. And today I bring you LB 115, a bill to define evidence-based home visiting in the state of Nebraska. And I just want to talk a little bit about this program and some of my experiences. So as a young mother with our first baby, I was so very lucky to have my mom come and be my support and coach me along in all the things you need to do with a newborn. So I was very, very lucky. Even though as a young person, I had been babysitting babies, including newborns, since I was 12 years old. And I remember watching how to bathe a newborn at the hospital, the video on that about 5 times, just to make sure I could do it because I knew how slippery newborns were. But I was so lucky because I had a visiting mom come and stay with me and my husband as we welcomed our daughter and got the hang of being a parent. So now I want to fast forward to my time on the Lincoln City Council. So we have had a visiting nurses program in the city of Lincoln and Lancaster County for quite some time. But in this last year's budget cycle, the Lancaster County Health Department came to us and asked for 8 additional visiting nurses to help families all throughout the city of Nebraska, doing something that was a very transformative, universal program. And I want to stress that this is all voluntary programs that oftentimes these families, the pediatricians will say, hey, if you're interested in this, you can have extra help, or if you have questions, you can have a visiting nurse stop at your house at no charge to you. So now I'm going to try to answer the question, what is home visiting, and share about the different evidence-based models. Home visiting is an evidence-based service that supports the health and well-being of families with young children. It is voluntary, free for families, and cost-effective. Home visiting programs pair young families with trained professionals who tailor services to meet the family's specific needs. These trained professionals can be nurses, social workers, peers, and more, and they work to form trusting relationships with the families to help them reach their goals in child development, family health, parent-child relationships, school readiness, and more. They're there to facilitate questions and concerns that they might have about new things, as new parents oftentimes have questions. So here are some of the outcomes associated with home visiting participants. Outcomes for home visiting participants include that they are more likely to be enrolled in school and more likely to be employed. Home visiting participants are more likely to access prenatal care. They're more likely to have fewer CPS reports, calls to the emergency hotline, are less likely to need emergency medical care. Home visiting participants are more likely to start breastfeeding and to breastfeed longer. And home visiting participants engage in more positive parenting techniques, such as more reading time between parents and children, compared with families not enrolled in home visiting. So here are some outcomes associated with the children enrolled in home visiting programs. So children who are enrolled in home visiting programs have improved language and cognitive development. They have greater math and reading achievement in elementary school. They have reduced absentee rates and suspensions compared with children not enrolled in home visiting. So here is what can be confusing about home visiting. There are 26 different evidence-based models of home visiting in use across the country, with only a handful of them being implemented in Nebraska. Each model varies in the professional requirements of the home visitor, the length of the service, the type of curriculum utilized, and eligibility requirements. The goal is really to connect a family with the best and most appropriate model to meet their own needs. For example, if you're a new mother coming home from the hospital with your baby, the Durham Family Connects model may fit your needs best because it connects you with a nurse who conducts home visits with you focused on the health of you and your baby. Or if you are a family at risk for involvement in the child welfare system, this is before you're involved in the child welfare system, the Healthy Families America program might be a better fit because it is more intensive with weekly visits. So next, I'm going to share with you the history of home visiting in Nebraska. Home visiting has had a long history in Nebraska. In fact, if you speak with our public health departments, they were conducting home visits for new mothers decades ago, a practice that was lost in an era of budget cuts. The first legislative effort in the unicameral was in 2007, when then Senator Gwen Howard was able to include an allocation of $600,000 for nurse home visiting services in the budget. This line item has remained in the budget bills annually and has since increased to $1.1 million. Currently, Senator Vargas has a companion bill to LB 115, LB 114 that increases the funding for evidence-based home visitations to $2 million to maximize a new federal matching opportunity for this type of programming. And that's one of the reasons I'm so excited with the federal dollars allowing us to really increase our outreach. Okay, so now I'm going to turn to what LB 115 does. LB 115 creates a Family Home Visitation Act and places into statute three important pieces of the home visiting puzzle. First, LB 115 creates a definition in statute for what an evidence-based home visitation is, defining it as one with clear guidelines, a national certification, and high-quality service delivery. This is to ensure that state funds utilized for this programming are exclusively used for programs with clear success for families. Second, LB 115 calls on DHHS to create a website for evidence-based home visiting programs in Nebraska to make it easier for families and referring entities to connect with programs that suit their own individual needs. And third, LB 115 asks DHHS to submit an annual report to the legislature on home visiting in Nebraska to peel back that curtain on the successes of these programs and the efficacy of our state investment in home visiting. I'm passing out an amendment now. They got it. Oh, they got it. Okay. On LB 115, that does two things. First, it moves the date of the report to February 15th, and this was at the request of the department. And this is February 15th, 2025. Second, it clarifies that the report shall only include outcomes from programs funded by federal or state funds for this purpose, which the department is already reporting on to the federal government as opposed to all programs in the state. I believe that this should address the fiscal note where their agency requested an FTE to assist with the data reporting. I also want to take a moment to address the letters you received in opposition to LB 115. I have read through them all, and I believe they represent a fundamental misunderstanding of the difference between home visits, which are conducted by social workers and court-ordered when a family is already involved in the child welfare system, and home visitation programs, which are offered to families to support them. They're voluntary, and while they both use the same wording, they're very different in that the former is mandatory and the latter is optional, voluntary. LB 115 deals with the optional home visitation services offered by trusted providers and not social services and child welfare offered by the state. Because these services are optional, there is no constitutional issue in LB 115. The goal of LB 115 is to define evidence-based home visiting in statute to clarify a line item in our budget, already in our budget, that has been in existence since 2007, and pull back the curtain on the use of those taxpayer funds with an annual report on their utilization and efficacy. In closing, home visiting programs in the state of Nebraska are doing incredibly significant work for our youngest children and families. Often called the silver bullet for child abuse prevention, a robust and coordinated home visiting network in Nebraska can not only improve outcomes overall for our children, but particularly for those who are at risk of court involvement. And LB 115 is the first step in creating a statutory framework to support this important work. I really appreciate your time and attention to this issue, and I will be happy to try to answer any questions you may have, and I will also stick around.
Thank you for your opening.
You bet.
Are there any questions from the committee? Senator Raybould.
Thank you. I guess my first question would be, could you tell us who asked you to carry this bill?
I am carrying this bill on behalf of First Five Nebraska.
Okay.
And I can also share with you, I know Lincoln Littles in Lincoln, Nebraska is very involved in early childhood programming because data-driven results show that early intervention as early as possible with families helps create greater outcomes for our children.
Okay. I'm going to want to come back and because you talked about the mandatory part, some wasn't. I'd like to come back and visit that, but before we do that, I just want to comment. I know schools are now into home visits and Medicare Advantage is into home visits. I mean, it's like an invasion of the home for all of these recipients. And all of a sudden that becomes kind of a personal issue. I also, just as a sidebar, and of course, I have a full-grown son, and DHHS, when he was a child, they used to send out what I think was called the penguin letter. I don't know whether, oh, you're all too young. But it's very helpful. It said, they had his age, and they said, this age you should be seeing this and this and this. It was a simple little letter, but I know I went to it immediately when it would get there, just to hopefully see that we were on track. And it was very helpful. I don't know what happened to it, but I thought it was a great resource. That all said, I want to go back to because I am concerned with mandatory pieces, particularly going into someone's home. That's pretty invasive. So who was required to be mandatory and who wasn't?
These are, mandatory is something completely different. These programs are all voluntary, They're not court ordered. Those that are court ordered by child welfare and protective services, those are mandatory.
Okay,
this is a completely different critter.
Okay.
So these are voluntary programs. Like I said, in Lincoln, we actually approved the budget that allowed us to hire 8 more FTEs, visiting nurses, because we saw the benefits. So these programs, like your pediatrician, when you bring your newborn in for their first visit, the pediatrician will ask you, hey, are you interested? There's a great program that is in Lincoln Lancaster Public Health Department. If you would like more information or more details on how you can participate, and you can contact the department. Hopefully with the website, all the pediatricians will see all of the available programs in all throughout the state of Nebraska that make sense. And so it's not mandated. That's a whole different category. But both serve valuable purposes to help families, for those that are mandated, families that are clearly in distress, that need more parenting skills or more assistance with young children and the development issues that young children have. So, but some of those are often court ordered because they have gone through the Child Protective Services. This voluntary program that we know has proven to be very beneficial.
The 8 individuals were hired by Lincoln Council or the Lincoln Lancaster County?
They, I was talking about being on the Lincoln City Council. We approved in the budget for the Lincoln Lancaster County Health Department. They already have a staff of 4 visiting nurses, but we approved hiring 8 additional visiting nurses working through the Lincoln Lancaster County Health Department.
So if we hired nurses, and if Lincoln Lancaster needs 8, the state could need hundreds.
Well, there's I didn't mean to cut you off.
No,
But there's already programs that exist in the state of Nebraska. I don't know if you got a handout, but it has a map of all the programs that exist currently throughout the state of Nebraska, and existing community or nonprofit organizations already offer this service.
What's the fiscal note look like on this?
The fiscal note was 1.1 million, and we're increasing it to $2 million. But that'll, I'm sorry? Nope.
That's a different bill.
Oh, different bill? Oops.
No, $1 million here. $1 million there.
I'll let the experts talk about the funding, so.
Okay. So the source of the funding is not ARPA funding, it's not a one-time, it's an ongoing.
It's an ongoing funding that has been in a line item budget since 2007.
That's the administrative side of it, you can't do the staff. Okay, thank you, you've been very polite, very kind, thank you, Mr. Chairman.
Any other questions? Senator Walls.
Thank you. Chairman Hanson.
It's only 4 o'clock. We've got
Okay,
5
I'll
hours.
get going. 5 more hours.
5 more hours? You guys are good.
Yeah, we're good. We're used to this. First of all, I just want to say that I don't know if you've heard, but I'm a big proponent of Teammates, the mentoring program, which Governor Pellin is really trying to expand this year. I'm super duper excited about that. And I think that this program is pretty similar to like a Teammates, only Teammates, obviously, you're going to school and supporting kids in school, but here you're going and supporting whole families, which is great. So when I was a teammate mentor, I had to, pass a background test and things like that. Can anybody volunteer to be a home visiting volunteer? Can anybody do that? And what's the process? I'm very excited about this.
Well, I'm not sure I can answer that question completely, but I know that in Lincoln and Lancaster County, they are nurse practitioners. They can be nurse practitioners or social workers, but they do have extensive background and training, and many have already completed certification in the different types of models that are out there depending upon the needs of each individual family. So you just can't be a volunteer. You have to have certification and credentials.
You have to have an extensive background.
And oftentimes they're actually RNs, nurses.
Yeah.
Public health nurses.
Okay, got it. I just wanted to clarify that. So thank you. I'm excited about this.
Any other questions? Yes, Senator Kavanaugh.
Thank you. Senator Raybould, if I could just give an example of home visiting that I experienced.
Okay.
So my youngest had, now I'm going to forget what it's called. He had to have his bilirubins tested every single day. So he was my little glowworm. So I had a visiting nurse come to my house every day after he was born until that was no longer the case. And so it was a kind of this similar home visiting for me. Now, obviously, I didn't have to have her come to my house. I could have packed up my baby and driven him to the doctor's office every day. But I much preferred this option that was made available to me. And so I just wanted to share that with you because I think that this was voluntary and even my insurance covered it, but this would be an opportunity for somebody to have home visiting when they needed it. Also, if I needed help, I think under your program, if I needed help with nursing, then I could have a lactation specialist come into the home. Is that
You can have a lactation specialist or one of the public health nurses that is a specialist in lactation.
Which then you're having that added benefit of being in the comfort of your own home. Because I also with my oldest, had to pack her up and go to the women's hospital, which was great. But I went to some lactation group things because I had a lot of difficulty. The milk bank conversation that we had yesterday was very near and dear to my heart, but had a lot of difficulty with my first kid. Each kid is different. They all bring their own wonderful challenges, but it just sounds like this program would be great for so many different reasons, even if you have the access to it. Some of us have been utilizing home visiting, just didn't know it.
Yeah.
And it's
Thank-
voluntary.
And it's voluntary.
Thank you.
Thanks.
Any other questions? I might have a couple. It's more kind of a language thing with me, I think.
Okay.
And, or intent, I think. I'm kind of looking through the sections of the bill. And one of them is like, who describes who would be the visiting entities, right?
Mhm.
Nurses, social workers, early childhood, and health professionals. Who, like, is that where you're thinking of? You already have nurses on here, but who would you envision as like health professional that they mean in the bill here?
I'm not quite clear. I think it wanted to be a little bit broader on health professionals. I don't know if a child has difficulty walking, and it could be a physical therapist that, after the first few visits, one of the nurses would recommend, hey, I think a physical therapist would help increase your child's mobility, or maybe with little ones, strength training, if there's something for that, and maybe a physical therapist would be the appropriate
That's a good
individual.
example.
Or even a speech therapist, with 1 or 2 sessions to help the parent understand, like, here are some practical things you might want to try to do with your baby to help them enunciate better. So I think whatever that individual family's needs might be, trying to set them up with the appropriate support.
Okay. And that's probably goes along with trained and supervised lay workers. Is that kind of a similar?
So that would be probably more like certainly with a lactation consultant. They're not necessarily a licensed practical nurse, but it might be another peer, a mother that has had other children and can be a great coach on breastfeeding.
Okay, and the program is who determines the visitor? Who determines who goes into the home?
It's usually the visiting public health nurse can say, okay, I think this family might need just one visit. A first-time mother or parent, like, they're good. They really have it down, and sometimes that first-time parent needs that little bit of coach. You got this. You're great. You've got it down. And maybe another family, they need a little bit more help and assistance. They're concerned about temperature and how to swaddle a baby or not swaddle a baby, or try to coach them. Like, why don't you try putting your baby on their tummy, but keep the baby supervised, or just coaching tips that most parents need. But it just depends on the individual family. Sure. And I would say that the public health nurse is the first one who can tell exactly, okay, this is probably what would benefit the family the most.
Would there be certain people who would be excluded from this, like a priest, a pastor, or like a rabbi, or somebody like that? Would they be excluded? Like if somebody just determined, like, he happens to be a priest, and like I help with coaching children and adults and mentoring, like, because they're religious in nature. I know sometimes some organizations might exclude them because they want to kind of stay away from the religious aspect of it. I should know if that's an aspect of this or not.
I don't think I can answer that question.
And that's when you can. Somebody behind you might be able to. So I got put it out there now.
I'm counting on it.
They'll tell me. And then in section 4, I was trying to get a little better definition about what evidence-based program means. It just says a clear, consistent program. Like, in your mind, what is it? Because you mentioned that quite a bit in your opening testimony. What's an evidence-based program? I think if evidence-based, I think it's gone through rigorous, peer-reviewed studies, but I think a program like this is not kind of like, it doesn't mean that. So I didn't know what that meant.
Well, I wasn't going to go in all that detail, and I know that there are people behind me that can address it, but because there are different models that have different established criteria and curriculum, that have data that backs up the different programming types, showing that this is effective. This program will help with this type of situation. So evidence-based is exactly what it is. There's data. There's data that actually back up programming because they know it has worked
Okay.
in other communities. So
And that makes sense.
Yeah.
And again, somebody else can correct me on a lot of stuff too here.
yeah.
And then in section 4, number 2, the first line on page 3, is associated with or certified by a national, it tells like who they have to be certified by, a national organization. What are some examples of a national organization that they can be certified by?
Well, again, that goes back to the particular model of or curriculum for each one of the different programs that can be offered. And I'm going to have backup answer that question.
Okay, I'll wait until somebody wants to come up, and then if they can, then maybe you can fill me in later. So I'm only asking these because I'm kind of unfamiliar with this.
Okay.
And I just want to try to familiarize myself with some of the stuff here, so.
Terrific.
Thank you. Any other questions? Seeing none. All right, we'll see you at the close.
I'll see you at the close.
All right, so with that, we'll take our first testifier in support of LB 115.
Hi, good afternoon. Good afternoon, Chair Hansen, members of the Health and Human Services Committee. My name is Chris Jones, CHRIS JONES. I'm the Advocacy Director of NCHS. I'm testifying in support of LB 115, and NCHS is a statewide accredited child and family serving nonprofit with 3 core programs: family support, foster care, and adoption. So our teams provide a range of support to caregivers of all kinds, including birth parents, relative, kin, and foster caregivers, prospective and adoptive parents. We connect them with needed resources for healthy development and family preservation. Our organization is celebrating its 130th anniversary this spring, and we see the priority for the future is the investment in prevention programs to support children and families early, before a crisis takes place, through services like home visiting. I'm here to tell you a little bit more about what home visiting is, why LB 115 is important. Home visiting is a voluntary service that pairs home health or family support professionals with caregivers of infants and young children to provide parents with education, support, and skills to alleviate stress, promote healthy parent-child relationships, and connections to community resources, because parenting is difficult and stressful no matter the parent's circumstances. Like Senator Raybould mentioned, and I've heard others mention today, that newborn period right out of the hospital, right when you get discharged, it's terrifying. I had countless hours of training working in children and family services in Nebraska for many years. When you get discharged, you don't know what's going on. You're scared. There's all kinds of stuff going on with your body, with your baby. And I too had the benefit of having a family member come and stay with me. My mother-in-law came and stayed with me. That might sound scary to some people, but it was truly a blessing. And she stayed with me for almost a month. And it was absolutely essential to helping me and take care of my son. So anyways, evidence-based home visiting benefits caregivers, infants, and young children in many ways. According to the National Home Visiting Resource Center, home visiting has been demonstrated to improve early language and cognitive development, greater math and reading achievement in elementary school, and reduced absentee rates and suspension compared with children that don't have home visiting. Parents and caregivers also benefit in other ways, in the ways that Senator Raybould mentioned in her opening. So NCHS began doing home visiting in 2010 with the Teen and Young Parent Program. And then in 2013, we began offering Healthy Families America in Douglas County with the help of federal funds administered by the state's maternal, infant, early childhood, and home visiting program. So we have 3 HFA teams and 1 young parent support team. Last year, we served 153 participants in Douglas and Sarpy counties. The programs are free to participants. They're voluntary. People request them of us, and we are invited to provide these services to participants in their home. Families get connected to home visiting services through a variety of ways, including self-referral, contacting us, peer participants. So we have women and families who participate in our HFA program who like it and recommend it to their peers who are also expecting or recently gave birth. maternal homes, DHHS, and other community referrals. So during a home visit, a family resource specialist, and our family resource specialists, they are not nurses. They have either associate's degree or a specialized training in child development, or have a bachelor's degree. So they meet with parents and young children to engage them in a variety of activities or assessments using a strength-based curriculum that guides each meeting to work towards the goals identified by the parents. And that might be a variety of different goals, including financial stability, working on a degree or a training program, and other goals that they identify. So the Family Resource Specialist is a partner for parents, providing connection to items such as diapers, food pantries, housing, transportation, utility or rental assistance, and mental health services. Home visiting is a bipartisan and popular approach to promoting positive outcomes for families and is cost effective. National research has shown a return on investment between $1.80 and $5.70 for every dollar spent. These cost savings are attributed to reduced incidents of child maltreatment and child protection involvement, fewer children requiring special education and repeating grades in school, and lower criminal justice expenses. So LB 115, specific components of that bill that are important are the statutory definition of evidence-based home visitation, so that general funds are only utilized for high-quality programs with clear outcomes. The website where families can learn about and get directly connected to a home visiting provider in their community, and the annual reporting to promote efficacy and ensure that policymakers are aware of the demonstrated success of home visiting services in Nebraska. So we prioritize advocating for expanded access to home visiting within our 10-year strategic plan because we believe in its effectiveness and potential to truly partner with families to provide the support needed to be successful and prevent deeper end system involvement. Thank you, Senator Raybould, for introducing, and for the committee for giving me an opportunity to testify and talk about it today. I'll take any questions anybody has for me.
Thank you for coming to testify. Are there any questions? Yes, Senator Repe.
Thank you, Chairman. Are you a statewide organization?
Our nonprofit does provide services statewide. However, our home visiting is just in Douglas and Sarpy counties for now.
Do you have the capacity or the spirit for going statewide? Where I'm leading to on this is, rather than creating more bureaucracy, why wouldn't we contract with you as a provider if you already have a established system?
Yeah, I appreciate the question. So the map that you were provided, I believe, I didn't see it, but I'm familiar with it. There is a map of different types of home visiting, different service providers in different communities. We have capacity in the Omaha area, and we are interested in collaborating with other service partners and policymakers to look at how can not just NCHS, but other service providers in the state expand the reach of home visiting to all communities in Nebraska. Because like I said, all new parents of infants could use some support sometimes if they want it.
It's not uncommon to have a lead agency and they subcontract with other providers. You don't have to do it all yourself.
Yes.
Okay, thank you.
Are there any questions from the committee? Some
Thank
of the
you.
questions that I asked before, are you able to expound on any of those at all?
Let's see here. There was a lot of questions.
Yeah,
asked
that's
earlier.
fine. Like, I'm still hung up on the evidence-based.
Yes. Okay. So different programs have different credentialing bodies. So Healthy Families America gets their credentialing through Prevent Child Abuse America. I think that's right. Yes. Prevent Child Abuse America. Different certifying bodies are responsible for those evidence standards. And then the Health and the Human Resources Service Administration, a federal program, approves different home visiting programs for the federal home visiting fund.
Okay.
I can definitely get more information to you. The amount of research on home visiting is quite frankly very overwhelming, but I would be happy to get you information about the evidence component of home visiting.
I would love that.
Okay,
It's
yeah.
good because some of the studies said national research has shown to return investment $1.80 to $5.70. Like, where does that come from? Like, I get what you're saying. Like, oh, we help them, they're less likely to, et cetera, et cetera. But
yeah,
you can say that, but I'm kind of curious to know, like, where's the evidence that shows that it does that? So if we're going to spend taxpayer money on something, which might be
Certainly,
an awesome
yeah.
program,
Yeah.
I just want a little bit more kind of
Yeah.
comfort knowing that we're spending
Mhm.
money on something that's actually going to give us a return on investment
Mhm.
or is doing a benefit for the taxpayer.
Yeah, yes, I can absolutely get you that information. The range has to do, because there are about 26 different evidence-based home visiting models. That range that you see, the $1.80 to $5.70, different models are good for addressing different outcomes or issues. So the broader the model, the more evidence it is, the more effective it is in affecting different entry points of other deeper end systems, such as child welfare, trips to the emergency room, and special education, things like that. So
Yeah. It's just,
I
yeah,
can
okay.
get more information for you,
That'd be awesome.
is the short answer.
Okay. And are you able to answer, so we're stating the bill, what it's trying to accomplish. And one of the things is reduce child maltreatment and injury.
Mhm.
What does that mean? Like, prevent abuse?
Yes.
And like, how would that, like, you're recognizing maybe abuse in the home, or you're talking to the parent to reduce stress so they don't?
Yes,
injure
so
the child?
there's a couple different ways that a home visitor would approach that. So it's providing coaching, how to care for an infant and young child, but it's also education about developmental stages, cognitive brain development, what are reasonable expectations of children for different ages, and helping the parent with build protective factors and capacities to alleviate stress, have positive parent-child interactions, and others. Those are the things that come to mind.
Would you
So by equipping parents to better care for their children, they're less likely to harm their children through intentional or unintentional maltreatment.
Okay. Would they happen to go through a home, and if they see that there are dangerous aspects of the home that they might need to report or put into a file, that they would report that to somebody, or they would note that, like?
Right. So as a home visitor is really a helpful peer, mentor, coach, professional to help the caregiver. So if there is a situation that is unsafe and needs to be addressed, they'll work with the parent to say, this is what's going on and this is why this puts your child at risk of harm. And also I'm a mandatory reporter. So if your child's been harmed because of this situation, I do need to make a call to the abuse neglect hotline, but we can make that call together. But that's a requirement of of all Nebraskans, actually.
I'm sorry for all the questions.
That's okay.
Because these are some of the questions I've gotten, and some of the ones I've just kind of, when I've read part of the bill. I know there's been some concern, like what the agenda is, right? Because I know some of these are different because of their manuals and because of their policy and procedures about what they're trying to accomplish. And so some people might say, I want to keep the home safe. And so if I notice there's a gun cabinet I see, I'm going to put that in my file and I'm going to share that. And maybe there's some ways we can have better gun safety, or they report to somebody. There's some people who might have a concern about that, you know, even if they're storing things safely. Some people might go in there and see that as a potential child maltreatment, or the potential for it, right? They could injure themselves in this aspect, not like a knife that's laying on the floor. That would obviously make sense, but sometimes people might have different ideas about what child maltreatment could be. And so those are some of the questions that I've gotten. And so I'm just trying to get everyone else's point of view. Like, oh no, that's completely ridiculous, or I can kind of see where that might come into play, or do you hear about any of that kind of stuff at all, like from your organization or somebody else, or?
No, I don't know that I've heard that, but I would say our home visitors work with parents and they help educate about what are threats to child safety, and provide them coaching about that, and then also connections to other community resources if needed.
Okay.
So I'm not aware of that.
Okay.
That's been an issue.
I just want to get your opinion.
Sure. Yeah.
So it helps me get a better understanding about it. So thank you very much.
Yeah.
Any other questions? All right. Thank you for testifying. Appreciate it.
Yeah. Thank you.
And we'll take our next testifier in support, please. Welcome.
Good afternoon, Chairman Hansen and members of the Health and Human Services Committee. My name is Jess Parker, spelled Jessparker. I live in District 30 here in Lincoln. I am a parent ambassador and parent ambassador mentor through Nebraska Early Childhood Collaborative. Although today I am here in my own personal capacity as a parent in support of Senator Raybould's home visitation bill, LB 115. I will be sharing my family's personal experience with the Early Head Start home-based visitation program with you all. I have 3 kids. All of my kids have voluntarily participated in various capacities of Head Start programs and Early Head Start home-based programs. We were initially referred to the Early Head Start program through the Nebraska Early Development Network. The Early Head Start home-based program is an evidence-based home visitation model where a certified and screened childhood educator visits the enrolled child ages birth through 3 and their family in their home weekly. The home visitor provided me with educational curriculum-based activities to do with my child throughout the week based on my child's interests. In addition to educational activities, my child was routinely screened using the ASQ and other data-driven evaluations to make sure he was meeting all of his developmental milestones. Home visitors were trained on certain technology to allow vision screenings and hearing screenings to take place in-home during weekly visits if needed or requested. As my son began having vision and hearing difficulties, the screenings our home visitor did became a great resource to me. These results helped me feel more prepared to address concerns when I took him to his well child checks at his pediatrician's office. Early Head Start served not just my enrolled child, but our family as a whole. We set goals with our home educator, track the progress of our goals over time. In addition to my son's weekly educational visits, we also had weekly in-home visits with the nutrition and wellness coach who is available to us also through the program. We set goals together for meal planning and overall nutrition. We cooked together, tried new foods, and even learned how to garden so we can be more self-sufficient and grow our own food. Our home visitor was always a person I could turn to if I had a question. Whether the question was about parenting, developmental milestones, car seat installation and safety, navigating benefits, or finding additional resources. This program really set the stage for well-rounded care for my child. Early Head Start had such a lasting impact on myself and my family. I learned something new every time we met with my child's home visitor. I will never forget my son sitting by the door, looking out, waiting to see his home visitor's car pull into the circle, and screaming in excitement when she arrived. I would love to see this bill advance so more families across our state have access to home visitation services. Thank you for allowing me to testify today. I would also like to thank Senator Raybould for her continued support of home visitation programs.
Any questions from the committee? Seeing none, thank you very much.
Thank you.
Take our next testifier in support. Welcome.
Good afternoon. My name is Lindsay Casper, Lindsey-Cassessler, and I'm a public health nurse at the Lincoln-Lancaster County Health Department. I have worked as both a home visitor and a supervisor in our evidence-based home visitation model, Healthy Families America, or HFA. Our program is designed to work with overburdened families who are at risk for adverse childhood experiences, including child maltreatment. Some of our many goals are to strengthen nurturing parent-child relationships, promote healthy childhood growth and development, and enhance family functioning. Families are often referred to our program from their healthcare provider or the hospital following the birth of a new baby, and we accept and encourage any community referrals such as cultural centers, family and friends, and self-referrals. To determine eligibility, the HFA program uses 2 systematic tools that effectively determine which families will most benefit from intensive home visiting services. An initial screening includes assessing for criteria such as late entry into prenatal care, mental health issues, and/or a history of substance abuse. Following the initial screening, an in-person assessment is completed in which we use a structured tool for learning a family story, understanding their strengths and challenges, and setting the stage for their entry into what will be a supportive, meaningful relationship for the family. We offer home visitation beginning prenatally and lasting until the child turns 3 to 5 years old. Our services are free and participation is voluntary. Visits are initially offered weekly, and the intensity of services is based on the family. A family could expect to receive anywhere from 75 to 150 visits while in the program, depending on their unique needs. Because home visit frequency varies, a typical caseload for a full-time home visitor ranges from 10 to 20 families at any given time. Every home visit looks different depending on the family's needs, but I want to give you an idea of how a home visit is conducted. In general, I greet the family and ask how everyone is doing, what's new with them. I follow up on something that they told me about at the last home visit. As the visit progresses, I will complete any screenings I need to do and review the results with the family, along with offering referrals if necessary. I observe the parent-child interaction and use what we call reflective strategies to promote good interactions and address interactions that may need strengthening. I answer any questions the family may have, provide resources that they ask about, and use curriculum to provide education about child development, safety, and anticipatory guidance. I end the visit by asking if there's any information or resources the family would like at the next visit and thank them for letting me come. I'd like to share more about one family that I have been working with for about 3 years. I received the referral for this family from the hospital after their baby was born. I started visiting this mom weekly. She was very open with me about her ongoing mental health struggles. When I would arrive at the visit, she would hand me her baby and say that he had been fussy and she needed a break from holding him. This happened at every visit for the first few months, especially with mom saying baby had been fussy and hard to calm. I would talk to her and ask what has worked to calm her baby in the past and brainstorm other strategies to try. I knew that mom was severely depressed to the point of being hospitalized several times during those first few months. So I would get really excited if she found something that seemed to help her baby calm down or if she spoke positively about him. I also demonstrated good interactions with the baby by talking to him and making eye contact during the visits. I would promote mom's bond with the baby by pointing out how baby looked at her when he heard her talk or how he would smile at her when she looked at him. Mom's mental health did improve after several months of trying a new treatment, and she stopped handing the baby to me when I arrived. She was able to hold him and interact with him in a positive manner, along with showing me new skills he had learned since the last visit. Mom had her second baby about a year ago, and right from the start, she knew how to calm him when he was fussy. She talked to him, she smiled at him, and she really just had a completely different postpartum experience than she did the first time. As a home visitor, I feel like my biggest role with this family was being somebody she could talk to without being judged and building her confidence in her ability to parent. Another mom in our program has been receiving home visits for the past 2 years after the birth of her baby. One of her goals was to complete college, but she let this goal go after getting pregnant because she didn't think she could achieve it. After starting Healthy Families, her home visitor helped her re-enroll and start classes again. Together, they found her an internship that was needed to complete her degree program. She recently graduated with her bachelor's degree in education and human sciences and accepted a job offer in her area of study. Many of our participants set and achieve either education or employment goals. In fact, 95% of moms currently enrolled in our Healthy Families program are either in school, in a job training program, or employed by the time their child reached 2 years old. Last year, we provided nearly 5,000 visits to over 300 families. During home visits, our staff promote the parent-child bond, educate families on child development and parenting, and share health and safety information. They help with family goal planning, establishing medical homes for healthy pregnancy and infant care, and provide screening and referral for developmental delays, substance abuse, mental health, and family violence. Home visitors also help connect families to needed community resources and services to address needs like food insecurity, medical insurance, housing, childcare, employment, education, and so much more. All of this work is done before any calls are ever made to the child abuse hotline about families who might be at risk, saving the state money and the trauma for the family of being court involved for preventable challenges in the home. I have included with my testimony additional local data on the outcomes associated with HFA in Lincoln and Lancaster County.
Thank you. You read that pretty fast.
I did.
You got through it though. Thanks for your testimony. Is there any questions from the committee? Yes, Senator Walsh.
I don't have a question, just a comment. If you weren't going to tell a couple stories, I was going to ask you to. So I appreciate the stories because I think it really gives us a good insight as to how important it is to connect with families early on. So thank you.
Yep, you're welcome.
Any other questions? Okay, I just have maybe one. This is not on behalf of the Lincoln Public Health.
It is. Our Healthy Families America program is through the Lincoln Lancaster County Health Department.
Okay. And then they're the ones who help fund this? Or like the materials that you use and?
So it's state funding through McVie, I think federal funding, and then sometimes grants.
Okay.
That funding.
Okay, thank you.
Right. Thank you.
Yep. We'll take our next testifier in support.
Good afternoon, Chair Hansen, members of the Health and Human Services Committee. My name is Tim Haruza, last name spelled H-R-U-Z-A, appearing today on behalf of CAFCON. the Children and Families Coalition of Nebraska. Sorry about that. We are an organization made up of 10 child welfare service providers from across the state, statewide reach. I'm appearing today. I intended to just pop up and kind of echo what's been said before to support the efforts of Senator Raybould. I appreciate her introducing the bill today, but I also do want to provide, I know there's been some questions and maybe some confusion. I thought, well, most of my providers do provide, or I guess a good chunk of them do provide the type of services that Senator Reapy had asked about before, I think early on in the hearing of Senator Raybould, but the types of court interactions, forced home visitations. I think there's some confusion about the types of visitations that we're talking about with LB 115 versus those where you talk about system involved parents or youth where a child has been maybe removed from the home or is in foster care. Some of our providers, Nebraska Children's Home Society, who you've heard from today, would provide these types of voluntary home visiting services. And I'd point you to the very first page of the bill and the definition that's supplied for the types of programs that we're talking about. But these truly are voluntary services. We support efforts to provide those services for families that need them and that can benefit from them to help ensure that the children maintain safe and don't end up in a situation or a position where they're being removed from a home or taken from their parents in an instance where you have court-ordered visitation or those types of things. So I do want to be very clear that those are situations in which there are law violations or there are abuse and neglect allegations that have been made. That's a completely different type of the area of the law that we're talking about. These are voluntary programs intended to help provide supports for families, for children, and ensure that, to your question earlier, Mr. Chairman, about kind of how you get that return on your investment, but to ensure that we don't have problems on down the line. So again, I just provide that context. I'm open to any questions that you might have, but what Senator Raybould's doing, what the advocates you're hearing from today are good things that will help children and families avoid the need, hopefully, for future services on down the line. Entirely voluntary. So thank you very much.
Thank you for your testimony. Any questions? Sure. Okay. Are you able to provide me some of that evidence-based data that we're talking about here?
Oh, we'll get you some. We'll get you something. Yeah. So in terms of that return on investment calculation, how that comes up.
We're trying to keep people out of government care, right? I mean, in essence, right? We're trying to keep them out of the courts. We're trying to keep them off food assistance, whatever. I would think some of the states that have implemented this more, or we have, I don't think we have at all, this type with DHHS involvement, but other states that have, what have we seen, right? Like we've seen a decrease in X, Y, and Z that shows, okay, it's actually working. But
we've definitely seen a national trend toward, prevention services ahead of system involvement. So that's where you have, I don't remember what it was, 2018, 2017, Families First Prevention Services Act, federal law passed to recognize and see kind of how that's trending, that when you get involved and when you get family supports earlier, you can avoid some of those back end things. First Five is the organization that is probably best positioned to give you the data and the background in terms of how getting involved with children under the age of 5 and in early interventions, make sure that they provide supports both for parents and again for youth, that they're more successful on the back end. Well, I'll work on making sure that we get you that data.
Yeah, good. And that's some of the reasons why I'm asking some of the questions from people that I've heard, because I've heard people who really are excited about this program, and I have had people on the other side who are concerned anytime we start saying we want to be proactive in helping families with government care. In essence, and that raises a red flag for a lot of people, right? And so you're in my home, the government's going to help you take care of your child early, proactively, instead of waiting for something to happen, where the government should step in then, help out in that instance.
Definitely understand some of that hesitation. I mean, I myself am fairly conservative when it comes to those sort of things. I'll also tell you too that, you heard Nebraska Children's Home Society testify earlier. These are private entities that are providing some of these services too, that again are aimed. Many have supports from private donations and those sort of things that help bolster some of that expense. But I think what we find, and that's what your evidence will show, is that when we make public investments and that are strategic and are calculated and are aimed at providing supports for those parents, we get a return, right? So we avoid having to spend things on system involved youth and those sort of things. And it helps prepare children for their school age years and families to avoid the pitfalls that I think everyone's concerned about, right?
Yeah,
Which is
the funding or the data is more like the quantity part.
Yep.
And there's a quality part, like what are you going in there doing in the home? That's why I was asking some of the questions on that. That's just trying to filter some of this out. So that's all I had. Any other questions from the committee? Okay. Thank you very much.
Thank you.
We'll take our next testifier in support. Here she comes. She's got all the answers.
I have all the answers, and I apologize for being so late to the party. So, good afternoon, Senator Hansen and members of the Health and Human Services Committee. Thank you for allowing me to testify today. My name is Sarah Howard, spelled S-A-R-A-H-O-W-A-R-D, and I'm a policy advisor at First 5 Nebraska. First 5 Nebraska is a statewide public policy organization focused on promoting quality early care and learning opportunities for Nebraska's youngest children. So my position at First 5 is focused on maternal and infant health policy. This is my last bill of the year in front of the HHS committee, but Senator Ballard, I hope you understand this is the best committee in the legislature, and I hope you're really enjoying your time here. Okay, so home visiting, it's confusing, right? I'm actually really glad that I get to sort of close you out in terms of support. We have had home visiting in the state of Nebraska since 2008. So we have been personally funding with general funds home visiting in the state of Nebraska since 2008. In 2007, my mother put in a line item in our budget, and spoiler, actually, Senator Hansen, Senator Reapy, you have both voted for this line item in the past. So my mother, who was a 34-year veteran of the Health and Human Services Department, she was a social worker, a frontline social worker. She saw that other states were starting to implement nurse home visiting, and she realized that people will not open the door to a social worker, but they will open the door to a nurse. And so they were more willing if a nurse came in and said, "Tell me about your baby. How can I support you? What do you need?" And so my mother put that in 2007. And at the time, the line item said nurse home visitation. In 2009, the federal government passed the Maternal and Infant Early Childhood Home Visiting Program, or MICV. You've heard that acronym kind of get kicked around a little bit. And that changed the work of home visiting across the country because it really broadened it from just nurses to evidence-based models. So we're going to dig into that, okay? In 2013, cough it up, do you need water? I have cough drops in my purse. In 2013, I modified the line item in the budget to go from nurse home visiting to evidence-based home visiting so that it could really broaden the reach of those funds. And then the McV program in the state of Nebraska, we've been drawing down federal funds for this program since 2010. I'll tell you about the McV program, and then I'll tell you kind of what's cooking in terms of evidence-based home models in the state of Nebraska. The McV program is an interesting federal program because you receive a baseline amount of funding. So there's no matching opportunity for the states, or there previously hadn't been a matching opportunity for the states. So it's a program that has to be reauthorized every 5 years. And previously, Nebraska's baseline was $1.2 million. And then we would leverage the federal $1.2 million with the $1.1 million that was in our general fund budget that pretty much everybody has voted for except for Senator Powell. Okay, so in this last iteration of McV, which was reauthorized in December, and I'll give you just a spoiler, McV is wildly popular. When Chris Jones was talking, it's Chuck Grassley on the Senate side who really pushes it. And then our own Adrian Smith has actually was the sponsor of the McV bill for this reauthorization and then the previous reauthorization because of its efficacy in preventing child abuse. So now in this new iteration, our baseline amount that we're getting is $1.7 million. And then our general fund amount that we have to provide will be $1.1 million. That becomes maintenance of effort. We won't be able to go below that. And then the Vargas bill that was referenced is actually to increase funding so that we can draw down a new matching opportunity, which was something that some of the conservatives in Congress really wanted to start seeing. They really wanted to see states have more skin in the game in McV. So evidence-based. So because we've had about 2 decades of different programs around home visiting, there have been a lot of academic studies that I will absolutely provide you with. The ROI that they're talking about when they think about finances is predominantly hyper-focused on medical. And that's because when a new mom comes home and a nurse is able to chat with her about her baby, do some lactation consultants, baby's fussy or something like that, that new mom, her first visit is going to be to the emergency room. But if a nurse is coming in a couple of days, they might talk to the nurse about it before they go to the emergency room. And so the financial ROI that you're seeing is predominantly on the medical side. That being said, over the course of several years, because home visiting can be offered prenatally and postnatally, generally up to 3 years old, you start to see some ROI on that cognitive behavioral development. So they follow children all through school, and you see that kids who had home visiting early on will actually have better reading and math scores in their 3rd and 4th grade, which is pretty remarkable. So I will follow up with some of those studies just so you can dig into it a little bit more. I do think there's some confusion when we think about sort of the opposition. I read through some of the opposition letters, and I think some of the key components of that are that home visiting is something that you're a new mother and you're being offered support, and most often you'll take it. Home visits that are court mandated, you have to take them. That social worker is coming into your home and making sure your kids are safe. So that's really the sort of the line in the sand between the two of them. I'm happy to try to answer any questions you may have.
Finish your thoughts.
Well,
I can't cut off.
You can always cut me
previous
off.
chair.
I'm very comfortable being cut off. Senator Riepe, I did want to make sure that I answered your funding question. What's weird about this situation is that we should not have line items in our budget that are not defined somewhere in statute. Do you know what I mean? Like, we're funding something and we've never said what it is. We've never, as lawmakers, said what it is. So this money could actually go kind of anywhere that looks like home visiting. And so essentially what you're being asked to consider as policymakers is defining something that's already in the budget, using the exact same languages as in the baseline of the budget, asking for a website so that other providers can find these services, and then that report. Because what worries me a little bit is that we have no idea how these programs are doing without a report to the legislature saying, you know, we have been investing $1.1 million every year, and we have no idea as policymakers whether it's doing what we want it to do. And so I think the report is one of those sort of essential pieces, but it's hard because you can't have a report without a definition. You've got to define what it is before you can report on it. And so that's why you're getting sort of this type of bill, which in essence, honestly, at the end of the day, should be an easy bill. You're defining something, you're asking for a website, you're asking for a report. But I appreciate that there is some confusion about what home visiting might be.
Spending money on stuff that we have no idea what it is. You just described half of government.
It's bananas, Senator Hansen. And so I think it's
I'm
funny
starting
because
to find that out. It took me 4 years.
we're working so hard to provide some clarity on these programs because, you know, we've got fans. Home visiting has fans. They've got fans nationally. We've got fans locally. Like, people love home visiting. They love that these programs come before a judge is ever involved in your family's life, right? So there are fans up and down the road. The problem is that there's no way for us to say, hey, is it working? Like, you're a fan, but like, is it actually doing what we want it to do? What if we tried having just that annual report? And so, you know, Senator Raybould's amendment, that changes the date of the report. DHHS requested that. And then it also clarifies that the report is specifically about programs that are funded by our money. To really like nail down, like, I don't care about programs that are privately funded. You know, Senator Raybould talked about the nurse partnership, the nurse family partnership in Lancaster County. That's locally funded. We wouldn't be wanting a report on that necessarily. But I think state general funds, $1.1 million is a lot of money. And so I think it behooves us to consider laying eyes on how those funds are being used.
Any questions from the committee? Senator Reed.
Do you anticipate that Lancaster and Lincoln then, I mean, they're funding 8 FTEs at quite an expense. So it seemed to me, if I were them, I'd withdraw that and just say, this should become a state responsibility.
Sure, that's a good question. So the state is only funding a model called Healthy Families America, which is
a model.
A
Is that
model.
a pilot project?
Nope, it's not. So home visiting has different models. Senator Raybould actually has a fun handout that I made for you guys with the different models. So there's Healthy Families America, which is pretty intensive. There's a 6 Pence Parents as Teachers model, which is like a peer model. And the one that Senator Raybould was speaking to is the Nurse Family Partnership, which is every newborn baby is offered visits from a nurse. Healthy Families America is the only one that is funded by the state. And so her nurse model they couldn't supplant those funds because that's not a model that the state is willing to fund at this time.
Okay. But going back to your other question, if I may, sir, yes, we were taking fundamentally line item budgeting that was so that you could track it
It's, wait,
with the idea of saying, here's the statutory requirement. These are the money that was assigned to it. So as a legislature, we can see if the money that we weren't just pouring soda pop into the ocean and wondering what happened to it.
yeah, that's essentially what we're asking you to consider putting in statute is a report that says, hey, how is this money being used? And what are the programs that you're using it for?
Wouldn't that apply to a lot of things that we do?
It would, yes,
Yeah.
yeah, absolutely.
So we might be setting precedent or something. Okay, that's good.
I don't know.
Thank you. It's good to see you again.
It's nice to see you as well. I don't know if we're setting precedent per se. The only other piece that I'll mention is that home visiting is not only funded by McVie in Nebraska. So we've got general funds, McVie funds. We are also using TANF rainy day funds for this, which I know this committee is kind of lays eyes on TANF rainy day funds regularly. This is an appropriate use of TANF rainy day funds because it's for
Sounds to
at-risk
me like a new
families.
concept called accountability.
Well, we're trying it out. I'm hoping you'll be interested in it as well.
Any other questions? Maybe just one more clarification. So what makes this Healthy America?
Healthy Families America is listed nowhere in this
What
bill.
makes it different from these?
From the,
Because you said we're already paying for it. I'm assuming you meant the maternal infant child and home visiting. That's McVie, right?
yeah, McVie and
Head
state
Start.
funds are only paid for one, they only pay for one model, and that model is Healthy Families America.
Okay. And that's the one
One-
we're implementing right now, currently?
Oh, yeah, there are 6 different models being implemented in the state right now, but a lot of them are funded privately, or they're using local dollars.
Okay, so just make sure I'm right. So then what we're trying to do here is another model?
We're not talking about models, we're defining all of them. Evidence-based home
Gotcha.
visiting is
Okay.
all of them, and then there are 6 different models. Actually, I'm really glad you asked that question because it is super confusing as a policymaker to be like, wait a minute, so you're talking about a Healthy Families America, or you're talking about nurse-family partnership?
Yeah.
The bill would define all of the models. They would all fall under the definition, which is why it's pretty broad when you think about it. When you were asking questions about what does this mean, a nationally accrediting body? Well, Healthy Families America has an accrediting body. Parents as Teachers has an accrediting body. And so you want to have those models that are receiving funding have that national certification so that we know that they're maintaining fidelity to a model that has an evidence-based.
Okay.
Yeah, I'm clear as mud.
Got it now. So
Okay,
it's
cool.
all just kind of filtered in my head now.
Awesome, okay.
It's like a family tree of stuff.
It is very confusing. I do not blame the confusion.
Okay, all right. Seeing no other questions, thank you very much.
Thank you.
Is there anyone else wishing to testify in support of LB 115? Is there anybody, seeing none, is there anybody wishing to testify in opposition to LB 115? Welcome.
Hi. My name is Marilyn Asher, Marilyn Asher. I am the proud grandmother of 12 grandchildren, 5 of which are under the age of 5, or 5 or under. I'm a former state employee with the Nebraska Department of Corrections, and I have a real heart for young families and young children. And after working at the Nebraska Correctional Youth Facility in Omaha for 15 years with the Department of Corrections as a volunteer coordinator, I made an effort to help young men whose families were very destructive and difficult at their early ages. And I received awards for the mentor program that I did start, and I'm very proud of what we did accomplish there. But I realized that the root of the problem was their early childhood. But I do have concerns about the way this bill is worded, and I have some questions. So I'm going to go ahead and read these, even though Senator Raybould and some of the others have answered some of these questions. LB 115 does not state what criteria should be used to determine if a home needs a visit from the home visitation program. I'm talking about what's contained in the bill, not what they've talked about today. There are no standards that set how homes should be chosen. And not only are there no objective standards, there are no standards that I could see spelled out in the bill. Who decides on the home visitation standards? If I have a messy house, do I fail those standards? What authority is providing the program manual on page 2, line 6, item 4. What is meant by culturally competent staff? Section 8, line 23 states, the department may adopt and promulgate rules and regulations to carry out the Family Home Visitation Act. This represents bureaucratic authority and it does not spell out the limits of power that will be held by the department. Section 3A states that home visitation will improve maternal, infant, or child health outcomes, including reducing preterm births. Could that possibly include encouragement for abortion if the home is poverty-stricken and there are already a number of children in it? What is meant in Section 5, line 15, when it says that home visitation funds may be used for workforce purposes and to assist the programs and individuals in receiving and maintaining certification for home visitation providers? Is this an education program for Nebraska state employees to enter the homes of Nebraskans and give subjective evaluations on a random aspect of the home? Perhaps that's, after what we've heard, that is not exactly true, but that entered my mind as I read the bill. Section 9, items 1 through 11 call for data collection that is to be turned into the clerk of legislature. And for what purpose is the data collected? There doesn't seem to be an end game in this program. It doesn't sound like these people will be working themselves out of a job. It will be a perpetual government program at the cost of taxpayers. Another question is, how does this bill interact with Amendment 4 of the United States Constitution and the right of the people to be secure in their persons, houses, papers, and effects against unreasonable searches? Who determines if a visitation is reasonable, and will it be done at the request of the inhabitants of the home? As was covered, this is not dealing with things like child protective services, but it did enter my mind when I read the bill itself. Finally, I believe that the Family Visitation Act is not a well-written bill. It does not stipulate specific purposes, even though it is going to cost us $2 million a year. It's in addition to the programs which we already have in place. And I'm not a fan of the nuclear family in Nebraska being scrutinized by subjective government officials for purposes which are not clear. So I do appreciate the concern for young childhood development, but I have some real concerns about this bill. Thank you.
Okay, thank you for your testimony. Are there any questions from the committee? Senator Walls.
Thank you.
Okay.
Chairman Hansen, thanks for
Okay.
being here.
Mhm.
Appreciate all those questions. And you're right. I mean, there is a huge need to help families and support kids. I'm just curious, you, again, had a lot of good questions. Have you talked with Senator Raybould, or have you sat down and asked those questions with organizations or the senator?
No, I
Okay.
have not. Senator Raybould's office contacted me on the way down here. I saw there was an email, but
Okay.
yeah, I'm just concerned about government trying to perform this service and feel like perhaps it's a duplication of services, as has been mentioned previously by some of the senators here.
Right.
So,
Okay. Do you, I mean, my first thought was maybe this is a duplication of services, but the more I thought about it, the more there's a lot of need out there, as you know, with the past experience that you've had.
right.
So, okay, well, that was all I just wanted to see if
Okay.
you had questions answered from Senator Raybould.
Some of the discussion beforehand has answered some of my questions, but
Okay.
I'm still concerned about some of the generalities in the bill. Thank you.
Thank
Any
you.
other questions? Just make sure.
Okay.
All right, seeing none, thank you. There's another testifier in opposition. Well,
Hello, my name is Jeannie Greisen, Jeanne. Greisen, and I'm here on behalf of Nebraska's for Founders Values, which we are about protecting children, the First and Second Amendment right in all 93 counties in Nebraska. And I agree with what the testifier in front of me said about this particular bill. And I obviously, from being at some hearings, I've been in front of this committee before too. There's clearly a battle going on for our children, whether it be in the schools, the colleges, and now we're going down to the preschool level, and now we want to go into people's homes. Why is there a battle for our children? That's what I want to know. And why is there so much money that people are wanting to get to battle for our children? So we look at the colleges, they've already been taken over. You have indoctrination going on. We have Senator Jen Day that says she cares about kids at daycare centers. However, we don't even have our children safe in K-12 school. So we have that going on in there at the schools. Then we go down to the preschool. And if you listen to some home daycare people that want to take care of children, that's being taken over by the another part of the government. They're taking, the ESU is taking over some of those, and she's get put out of business. So now if that's not enough, now we want to go into people's homes and say, we're going to teach you how to raise your children. At some point, the government needs to butt out. People have family, they have their neighbors, they have their friends that help support them to raise their children. And I say that because I have a lot of minority tenants that live in some of my rental properties. And I don't treat them like a tenant. They reach out to me. They've created little pockets within the city to help them raise their children. So they create their networks. They don't need the government to be their network because they can do it by themselves. And so I'm looking at the money, and Senator Raybould said, well, this is free for families. It is not free when it comes off the backs of tax-paying Americans or tax-paying Nebraskans. So it's not a free program because somebody's paying for it. And then another thing, there was some comparison saying, well, these children do better than the kids that don't get part of this program. Well, how would you know unless you're data collecting? And that's another part that's going on at these schools. There is so much data collection going on all these children, and that is a darn shame. Somebody needs to stop all this data collection that's going on. And so that data collection is going to go down to people's homes now too. So if we want to protect our children, let's protect their data, okay? And we saw that happening at the University of Nebraska as well with all of COVID. So then the other thing, we had talked about the Department of Health and Human Services, and I think it's this committee's job to rein in the Department of Health and Human Services. We don't need to give them any more power. We saw what's happened over the last 2 years. It's about time that we put the brakes on and remove some of that power. And then I want to also just bring up, as I was listening to the testimony, because other people that were here, and I always do some research on who organizations are. And obviously there's a big play in the ESSER money that came down from the federal government. That funny, there's a line item in there saying in-home services are part of ESSER money. So is it really about the children, or is it really about the money? That's my question. That's it.
Okay, thank you. Are there any questions from the committee? Seeing none, thank you.
Mm-hmm.
Is there anybody else wishing to testify in opposition to LB 115? Welcome.
Thank you. My name is Dan Burdorf. Common spelling for Dan, D-A-N, Daniel, D-A-N, I-E-L, Burdorf, B-U-H-R-D-O-R-F. And I come before you today to voice my strong opposition to the proposed LB 115, the Family Home Visitation Act. As a resident of Senator Raybould's own District 28, like many others, I wholeheartedly believe in the principles and values important to Nebraskans, especially when it comes to our rights to bear arms and our support for freedom, equality, safety, and security, and the limited role of government in our lives. The tone of this bill, going off script a little bit here, the tone of this bill seems, in my opinion, to imply that some groups don't know how to raise their own children and may imply a class-based bias against groups, not the author's own. But to continue with my testimony, the idea of giving the state unchecked access to enter our homes is a violation of our privacy and a threat to our safety and security. And our homes are sacred and free places of care and should be protected, not subjected to government intrusion. The government's primary purpose is to provide for the safety and security of its citizens, not to intrude on their privacy. As a strong supporter of families, neighborhoods, and communities like many in District 28, I believe that the family is the best, basic building block of our society. Laws that intrude on the rights of families and interfere with parental rights only contribute to the dissolution of the family unit. We should protect the sanctity of the family and support families in their efforts to provide a safe and secure environment for their children. We recognize the needs to prevent child and spouse abuse, but the Family Home Visitation Act is not the solution. There are already measures in place to protect children and spouses from abuse, and this bill goes beyond what is necessary to prevent abuse. It would infringe on the rights of families and contribute to the government's overreaching authority. There are also already services that provide home visiting services. We've heard that in testimony already today. In conclusion, I urge the legislature and this committee to reconsider and reject the proposed bill, LB 115, and instead focus on measures that protect and serve families and preserve our rights and privacies. We believe in the strength of families, freedom, and neighborhoods, and we should not allow the government to intrude upon these building blocks of our society. Thank you very much.
Thank you for your testimony.
Thank you.
Are there any questions from the committee? No, seeing none. Thank you.
Thank you very much.
Is there anybody wishing to testify in opposition to LB 115? Okay, seeing none. Is there anybody who wishes to testify in a neutral capacity? All right, seeing none, we will welcome Senator Raybould back up to close. And for the record, where's my sticky note? I will say after you're done with your close.
Okay, wonderful. Well, thank you all very much. I want to thank all the testifiers who came out today. Did I mention that this program is voluntary? I didn't know if that came across as clearly as we want. It's voluntary, and this program already exists. This program is already funded. This program is effective. It's been around for 16 years. And I know I had concerns too, that we were adding 8 full-time public health nurses. And when I looked at the data, I'm a business owner, businesswoman, I saw the data and I said, how can we not invest in this type of program because of what it does? It helps give parents confidence. It helps answer any of their concerns and questions and instructs them on these are the great methods that help you be more successful as a parent. And so I want to say thank you again. And I certainly ask for your support. And certainly when Senator Vargas brings forward the matching appropriations bill that we have been appropriating funding for the last 16 years, I ask for your support on that too.
Thank you. Are there any questions from the committee? Yes, Senator Reed.
I always believe in philanthropy. And Susie Buffett seems to love early childhood development. I don't know, have we ever looked at Susie Buffett's foundation for any matching funds? If we can get the feds to match on one side, can we get a philanthropic organization to match on the other? And I only mention her because I think we're all familiar with her commitment to early childhood.
And I know that is one of the leading organizations. I can only tell you from Lincoln and Lancaster County, we go out for multiple grants from all kinds of organizations, including, foundations to help continue to fund and supplement these programs. Why do we do that? Because we know they're making a difference in the communities that we serve. We know they're making a difference in the families that we serve, and they have data-driven, proven effectiveness in making families stronger and better. And really, it's a prevention so that state government and other services don't ever have to intervene should that family get into a crisis.
I said that in part because I sat beside him with one of his financial people at some event, and he'd said that Miss Buffett had said, "Oh, it's only $1 million," you know, kind of like, really? And so she's got a lot of money. So thank you for being here. Thank you for presenting.
Thank you all for
Any other
listening.
questions from the committee? I have one question.
Oh,
I do
certainly.
have to ask about what one of the testifiers mentioned about the definition of reducing preterm births and her, what she talked about, workforce purposes. What are those? I'm feeling we're not going to get emails about it.
Okay, so I want to answer your second question. Workforce purposes are the funding that is used to assist the programs and individuals and also the practitioners that go out for their continual training and certification. But it also speaks to the costs that some of the providers incur to ensure that the staff, their members, are following appropriate certification and that they get the national certifications and additional training that help them do that. And then your first question, that's not the purpose of the program. They're there to assist and offer families whatever help that family might need at that particular time. So it's not there to judge. And again, think of these programs. They have been in existence probably since the turn of the century, when a nurse midwife goes out, the help with the birth of the baby and makes follow-up visits. And so they're not there to judge, but they're there to coach and help and educate. And certainly parents have questions, and these practitioners have answers that can help them be better parents and to help their children thrive.
And just for clarification, that workforce purposes, would that mean we'd be using some of this money to pay for people's credentialing?
I would say probably for their training and to make sure that they have the certification that they need.
Okay, would that be a private individual that we're paying for? Or to be like?
Would be all part of this funding that is currently there to assist in programming and the training and certification.
Okay, cool. All right, seeing no other questions, thank you very much.
All right, thank you all.
All right, and I found my note. So for the record, there were 9 letters in support and 36 letters in opposition to LB 115. So with that, we will close our hearing on LB 115 and the hearings for today. Thank you very much.
36.
Hey.
Thank you.